Right, order, order. We now come to questions to the Secretary of State for Health and Social Care. I start with Sir Charles Walker.
Thank you very much, Mr. Speaker. Mr. Speaker, question number 1.
Secretary of State.
Thank you, Mr. Speaker. I know that my honourable friend has long been a passionate advocate for smoke-free England, and I read his recent Westminster Hall debate with interest. 64,000 deaths a year are attributable to smoking, and it is one of the greatest drivers of health disparities in our country. And I'm personally determined that we do everything we can to reach the government's ambition of smoke-free 2030. And that's why in January I asked Javed Khan to lead an independent review into tobacco control. Once that review is complete, the government will set out its next steps.
Sir Charles.
State for his answer. To get to a smoke-free 2030, for every 100 people smoking today, we need to reduce that figure by 8, because smoke-free actually means 5% or less of the adult population smoking. Can I ask the Secretary of State to ruthlessly target those barriers that stop people stubbing out their last cigarette? We need to get the numbers of smokers down, because otherwise 2030 will be an ambition that is not achieved.
Mr. Speaker, my honourable friend is absolutely right. Smoking rates are currently 13.5%. That's the lowest on record. However, smoking remains the largest driver of health disparities in our country. The new tobacco control plan, which will be informed by this new independent review, will be looking to do exactly what my honourable friend says.
Boris.
Mr. Speaker, as one of the original campaigners for a ban on smoking in public places, I fully support what has just been suggested. But could I go further with the Secretary of State and beg him to come to House very soon with a plan that every child, every person, every family in this country can breathe clean, fresh air, away from the pollution coming from diesel vehicles and other sources?
Mr. Speaker, the honourable gentleman has long been a campaigner on this issue, and I commend him for that, and he's right to continue pushing. I don't want to preempt the outcome of the independent review, because it is just that. It is a fully independent review of government. But once that is complete, and I plan to publish it in May, hopefully, then I think that we can set out our plans.
Ben Bradley.
Number 2, Mr. Speaker.
Secretary of State.
With your permission, Mr. Speaker, I would like to take questions 2 and 19 together. The past few years have shown that we are our strongest when we work together. Earlier this year, we published the Integration White Paper, drawing on our experiences of the pandemic to develop a plan that will bring together the NHS and local government to jointly deliver for local communities. We have also created integrated care partnerships, such as programmes in Mid-Nottinghamshire and Northamptonshire, and we are already showing through that how we can bring health and local social care services together.
Ben Bradley.
That answer. I understand as COVID regulations come to an end, the discharge fund is also set to end. This could leave local government vulnerable, where there are no formal procedures locally to pass funding from the NHS into local government services, into local authorities, particularly as we seek to reduce hospital backlogs. We're vitally important that we get people out of hospital and into the appropriate care settings. So can my right honourable friend assure me that where local authorities are seeking to do that, seeking to tackle those backlogs, they'll have access to appropriate funding to be able to do it as we go forward?
I can give my honourable friend that assurance. Of course, we are already putting in record amounts of funding, both for local authorities to deal with the backlog that my honourable friend talks of, and into the NHS. But I do believe that with the plans that we set out earlier this month in the new plan for integration of NHS and local authority services for care, they will make a real difference.
Thank you, Mr. Speaker, and I thank the Secretary of State for his references to the work going on in Northamptonshire over health and social care integration. Can he assure me that that central role for local government in ensuring health and social care services work together to make the most efficient use of local resources will continue, and give me a clear guarantee that adult social care will not be taken over by the NHS?
Secretary.
I'm pleased to give my honourable friend that assurance that he seeks. The Integration White Paper, that signals our intention to go further and faster on health and care integration, building on the work that's already being done by the NHS, by adult social care, and by local government, jointly to deliver services. That plan will lead to better collaboration, and we want to make sure that responsibility, though, overall still lies, as it is currently shared, between local authorities and the NHS.
Valerie Vars.
Thank you, Mr. Speaker. The Secretary of State will know that Walsall Manor has been merged with Royal Wolverhampton. They share the same chief executive and chairman, without consultation with local people. How on earth can integration take place when Walsall Manor doesn't have a full-time chief executive who can ensure that this happens? Could the Secretary of State please ensure that Walsall Manor gets their own chief executive?
Mr. Speaker, I do understand the point the Honourable Lady is making, but it is about what works on the ground. And my understanding is that what's happening locally in her area is about a shared management team where they're sharing best practice and trying to look at challenges together rather than any kind of formal merger.
All right. Alex Norris.
Thank you, Mr. Speaker. Across the country, tens of thousands of people sit in hospital, medically fit to go home, but can't due to a lack of social care. And the Health and Care Bill should have addressed this, but didn't do. So, rather than just making us wait for more legislation, will the Secretary of State at least concede that local health leaders, be they in CCGs or in ICSs in shadow form, should be driving us locally as a matter of urgency?
Mr. Speaker, this is exactly what the new integrated care systems, the ICSs, are all about. My understanding is the Honourable Gentleman sat on the Bill Committee for the bill that's currently in front of Parliament to make that a reality. Come to the Shadow Secretary of State, Jake Murray. Went straight to.
Thank you, Mr. Speaker, and you clearly had a happy Easter. Look, Mr. Speaker, the fact is that the government's failure to fix the social care crisis is causing huge pressures on the NHS. As of last week, more than 20,000 patients were in hospital, fit to leave, but could not be discharged because the care isn't available. That means 22,000 patients waiting more than 12 hours in A&E each month. That means heart attack and stroke victims have to wait over an hour for an ambulance. So we're used to hearing about a winter crisis. Isn't it the case that after more than a decade of underinvestment in the NHS, a failure to fix social care, and the absence of a plan to even address the staffing challenge in the NHS or in social care, we don't just have a winter crisis, we have a permanent crisis in the NHS?
It's not the case at all, Mr. Speaker. And the Honourable Gentleman will know, and he does know this, Mr. Speaker, although he pretends not to, that the NHS and social care are facing unprecedented pressure because of the pandemic. He will know, as a result of the pandemic, that both in NHS settings and in adult social care, there has been a necessity for infection protection controls. He will know that staff absences are sadly higher than they have been in normal times, but the NHS is stepping forward with their colleagues in adult social care to provide whatever support that they can bring, especially with the record funding that the government is providing both to the NHS and adult social care.
Jake Murray.
Mr. Speaker, working with my honourable friend, the member for Hyndburn, we have been working with East Lancashire local authorities and our GP services to see if we can increase the number of face-to-face GP appointments. Would my right honourable friend, the Secretary of State, say what action he and the government are taking to ensure people in East Lancashire can see their general practitioner face-to-face?
My honourable friend, Mr. Speaker, is absolutely right to raise this issue. We've heard it time and time again in this chamber that the pressures our constituents are facing in order to get that kind of face-to-face access to their GPs. We all know why the situation was particularly bad at the height of the pandemic. We expect it to improve rapidly. The percentage being seen face-to-face is increasing substantially, and that's in large part because of the measures the government has taken, including the £250 million access fund that was announced a few months ago.
SNP spokesperson Martin Day.
Thank you, Mr. Speaker. Integration and service improvement cannot be delivered without sufficient staff, and the only way to attract people to a career in social care is by valuing them. In Scotland, they are already paid better than those in England and Wales. And through the National Care Service, the Scottish Government will improve terms and conditions for care workers through the introduction of national paid bargaining. Has the UK Government considered following the Scottish Government's approach and commitments?
State.
Integration between the NHS and social care requires the right level and quality of workforce, both in the NHS and in adult social care. In the NHS in England, we have more doctors and nurses, more people working than ever before. In adult social care, we are recruiting at high levels, not least because of the huge recruitment campaign that we ran together with the sector, and also some of the other changes we made, including the £400 million plus of retention funding over the winter period, and the support for workforce more generally is making a real difference.
Peter Bowe.
Mr. Speaker, in Northamptonshire, integration is getting on very well, and in fact, Councillor Helen Harrison heads the adult social services. But going back to what my honourable friend from Northampton South said, there is the worry that because the NHS is so big that it will overwhelm local government. Now, they don't, I told you, Secretary of State, they don't want to mess with Helen Harrison, but could you assure that there's a mechanism for reviewing that?
So, State.
Well, Mr. Speaker, I know that my honourable friend knows Helen Harrison extremely well, but he's right to talk about the importance of working together between the NHS and the adult social care sector and local authorities, but at the same time making sure it's a true partnership and one does not overwhelm the other, but they work together towards their shared interests.
Alan Morgan.
Thank you, Mr. Speaker. One of the key causes of the urgent care crisis in Shropshire in Shrewsbury and Telford Hospital Trust is the inability to discharge patients who are medically fit to go home into social care in the community. And Shropshire Council's resource challenges are well known, I think, in that area. I wonder if the Secretary of State can commit to putting extra resource into that area, into social care in Shropshire, so that the medically fit can be discharged into the community when they're ready.
So, State.
Mr. Speaker, the honourable lady is absolutely right to raise this issue, and the whole House heard just before the recess the results of the work done, the independent work by Donna Ockenden, and she's right to talk about that and the pressure that's been faced locally. I do understand that she's already reached out to my honourable friend, the Health Minister, and he will be meeting with her to discuss just that.
Question number 3, Mr. Speaker.
Minister.
Thank you, Mr. Speaker. The dental activity threshold has recently been raised to 95% of usual activity, which is another quarter-on-quarter increase to get us towards pre-pandemic levels of 100% of activity. But I fully recognise that before the pandemic, access to NHS dentistry was patchy, and the crux of this problem is the current NHS dental contract. So work is underway to reform this contract. Negotiations have started, so I'm limited in what I can further say on this, but I will update the House as soon as possible.
Thank you very much, Mr. Speaker. A number of my constituents are finding it impossible to get access to NHS dental care, including Alison, one of my constituents who worked as a midwife in NHS Hospital for 40 years. Some of them have contacted 40 different practices and haven't got anywhere. My understanding is there's been a 30% drop in the dentists taking on NHS work in Suffolk. Will the Minister explain to me what local work has been going on between the Department and the local NHS bodies to try and ensure that this is addressed? Good question.
Minister.
I thank my honourable friend for this question. He is quite right, and he's campaigning very hard to increase dental activity in his constituency. One of the key pieces of work is through Health Education England, who set out a range of recommendations in their Advancing Dental Care Review, which will do a number of things, such as increasing the skill mix and scope of practitioners across dental teams, and we may be require legislation to bring some of that work forward. They're introducing more flexible routes into dental training, and they're also doing some workforce modelling to identify the parts of the country with the biggest gaps, so we can establish centres of dental development in those areas. And I will look at Ipswich in particular.
Emma Harding.
Thank you, Mr. Speaker. My constituent contacted me to tell me that she'd broken her canine. When she went to contact her NHS dentist, she found she'd been kicked off the list, was looking at facing a bill of £4,000 to pay privately, which she simply doesn't have. I wonder what the Minister can do to speak to some of the dental practices about perhaps relaxing their rules around when people get kicked off their dental lists, especially since it's just been COVID and there might be legitimate reasons for patients missing appointments.
So I'm sorry to hear about the Honourable Lady's constituents' experience. There isn't actually a list system for dentists as there are for GPs. Patients can see any dentist when they have a dental issue. That said, we have asked dental practices to update their availability for NHS patients on the website. I was looking at the website this morning to see availability across the country, and many dentists still haven't updated their availability. So I'll ask officials, particularly in her constituency, to update those lists so patients can access NHS dentistry more easily.
Sir Peter Bottomley.
Can I join the Minister in thanking dentists and their associates for getting so much of the service back? Will she agree with me that in places like the Arran parts of my constituency, where people can't find a dentist, haven't been able to for 2 or 3 years, that there must be a way they can get on a dentist list and get treated, and that they should be properly rewarded? Dentists and patients will be grateful for a change in the contract.
Minister.
Many thanks, Mr. Speaker. Can I thank the Father of the House? He is quite right that the crux of the problem is that there isn't a shortage of dentists across the country. There's a shortage of dentists taking on NHS work, and the contract is the nub of the problem. And that's why we have started work underway to reform the contract. And there will be some short-term changes being announced shortly, and some longer-term reforms as well, which hopefully will help his constituents.
Jim Shannon.
Mr. Speaker, bearing in mind that dentists are now determined to turn their practices wholly private as they can't make ends meet with NHS prices, will the Minister pledge to review NHS payments to stop this hemorrhaging of NHS dentistry provision?
Minister.
I thank the honourable gentleman for his point of view. He is correct that the units of dental activity payments are a perverse disincentive. So sometimes when someone needs more extensive work, their dentist is paid the same as say, for 1 or 2 simple fillings. And that is the nub of the problem, and that is something that we're in negotiations about at the moment.
My honourable friend, the Minister, is absolutely right to talk about the contracts that we have with dentists, but should she not also be looking at the way in which dentistry is structured and the regional nature of the contracting, because it's outside of our clinical commissioning groups, which reduces coordination, reduces accountability, and something which is central to our health. Shouldn't this change?
Minister.
I thank the right honourable lady. She is right, and part of Health Education England's review of the overall system of where dentists are trained and where they fill the gaps is being addressed in their Advancing Dental Care review. And they're also working with commissioners at a local level to develop more opportunities in those places which we term dental deserts, where there is a lack of provision at the moment.
Shadow Minister for Roseland.
Thank you, Mr. Speaker. Mr. Speaker, NHS dentistry is in crisis. Patients are stuck with a never-ending wait for an NHS appointment or footing the bill for going private, which is simply not an option for most families suffering with rising bills and taxes. With a third of the population suffering from untreated tooth decay, when is this government, who have had 12 years, finally going to come up with some practical solutions that put the needs of patients first, rather than the half-baked and unworkable ideas we have heard to date?
Minister.
Well, I'm sorry to hear the tone from the honourable lady. It is actually the 2006 Labour dental contract that we're working under. She may have missed that for the last 2 years, during the pandemic, dentists weren't able to offer any routine care, and we've slowly had to work that up to 95% of usual activity. And she may want to play politics with this issue. Perhaps she wants to talk to her Labour colleagues who run the NHS in Wales, where 6% of dental posts were lost last year. So before she lectures this side of the House, maybe she needs to get her own side in order.
Steve Bryan.
Thank you, Mr. Speaker. With the exception of the last question, I don't think that anybody on both sides of the House who've raised this issue are playing politics with it. There is clearly a pattern emerging here of a backlog in NHS dentistry and access to it problem. I have an increasing number of constituents contacting me who've gone to their NHS dentist with an acute dental problem to be told they're no longer seeing NHS patients, and people who've fallen off the list, as the lady from Hull mentioned. So how can ministers help in the short term? And I know the long-term answer is around the contract. I used to give that answer too when I was in her seat. And will the minister meet with me over a cup of tea so that we can try and, as a start of a 10, get to the bottom of this, please?
Minister.
Well, I thank my honourable friend for his question. We've had many cross-party meetings with colleagues on the issue of dentistry, and many have raised constituency issues with me, and we have followed those up. The two things that I would suggest to him is firstly to speak to his local commissioners, because there is sometimes a problem with local commissioning of dental services, but I'm hoping he'll find now we're moving to 95% of usual activity, which is a significant change since last year, that his constituents will be able to access services more easily.
Steve McKay.
Number 4, sir.
Minister.
Thank you, Mr. Speaker. Earwax services are the responsibility of local commissioners, who are responsible for meeting their local healthcare needs. And depending on the arrangement of the local area, services should either be undertaken at local primary care practices or referred to appropriate local NHS services.
Steve McKay.
Well, obviously I want to thank the Minister for that answer, but I was recently contacted by a constituent who complained that she was told by her GP surgery that such services were no longer available on the NHS and she should consider obtaining them privately. This despite recent studies which link the effect of impacted cerumen on cognitive decline and dementia. In those circumstances, will she consider writing to clinical commissioning groups and reminding them of their obligations and patient entitlements?
Minister.
I thank the honourable gentleman for his answer. There is no national removal of earwax removal services. They can be commissioned still locally, and NICE guidance are very clear on the types of services that should be being commissioned. Traditional methods of manual ear syringing are no longer offered for safety reasons, but methods such as electronic irrigation or microsuction should be being offered. If his local commissioning group are not commissioning those services, I'm very happy to meet with him and them to discuss why not.
Thank you very much, Mr. Speaker. For decades, GPs did provide this service, and we all understand, because of NICE guidance, why they no longer offer syringing. But I have to say to my honourable friend, there is a gap in that many clinical commissioning groups are not doing this. We're talking about people with dementia. We're talking with people at end-of-life care who literally cannot hear and are going deaf. And I do think she needs to be very direct with clinical commissioning groups on this issue.
Minister.
I thank the honourable gentleman for his raising this point. He's absolutely right. There needs to be some consistency across the country in how these are being commissioned. And after questions today, I am taking this up with officials to see why this isn't happening consistently across the country.
Number 5, Mr. Speaker.
So stay.
Mr. Speaker, I'm determined to tackle unfair disparities in health outcomes, which is why I launched the Office for Health Improvement and Disparities. OHID's regional directors of public health will work with local government and the wider health system to empower local partners with the tools that they need to respond to disparities in their regional and local areas. And we will also be publishing a health disparities white paper later this year with a strong focus on prevention to improve health for the whole population.
Secretary of State for his answer, but the reality is a decade of underinvestment and mismanagement has meant 4.5 million people are on waiting lists and over 100,000 people shortages of staff before we even entered the pandemic. That exacerbated health inequalities. And while I welcome his announcement about the work that his department's doing, the reality is if you live in a constituency like mine, you're twice as likely to end up on waiting lists for over a year for treatment than those in better off areas. So while I welcome what he's announced today, can I ask that he puts in appropriate investment to go along with tackling these appalling health inequalities?
So stay.
Mr. Speaker, I think the Honourable Lady is absolutely right to talk about the importance of tackling health inequalities, and I think on that we absolutely agree, and I hope she will help contribute to the health disparities white paper I mentioned a moment ago. But I do think it's wrong of her to suggest that some of the current challenges we face is because of underinvestment or a smaller workforce than otherwise. We have the largest investment ever going into the NHS. Its budget this year is bigger than the GDP of Greece. It's the highest amount ever, rising by billions each year. We have more going to social care as well than ever before, and we have the highest level of workforce the NHS has ever seen in its history.
Caroline Down.
Thank you very much, Mr. Speaker. Surely one of the most cruel health inequalities lies in fertility treatment. Of the 106 CCGs in the country, only six limit the age at which women can have IVF treatment to 35, and 2 of those are in Hampshire. Would the Secretary of State meet with me to discuss how we can end this most devastating of postcode lotteries?
So State.
My honourable friend is absolutely right. Of course, I'll be very happy to meet with her and discuss this further. But I can also tell her that this is one of the key things that we will be covering in our new upcoming women's health strategy.
Shadow Minister Andrew Gwynn.
Warm words from the Secretary of State, but people in the most deprived parts of England are almost 3 times as likely to lose their lives from an avoidable cause than those in the least deprived areas. With the cost of living soaring and the Resolution Foundation estimating that 1.3 million people will be pushed into poverty as a result of the Chancellor's spring statement, these inequalities will worsen. Why won't he just admit that his government has failed the poorest communities and start doing something about it?
Thursday.
Well, Mr. Speaker, the honourable gentleman acts like health inequalities are something just emerged under this government. They've been long-running health inequalities in this country over decades under successive governments, and it's this government that is putting in record investment and coming with the ideas to deal with them. As ever, Mr. Speaker, the Labour Party, they have no ideas how to deal with the challenges that this country faces.
Jonathan Gillis.
Thank you, Mr. Speaker. Mental health is a serious challenge of our time, and it's totally unacceptable that waiting times, the average number of sessions and the minimum number of sessions is different depending on which part of the country that you live in. And sadly, in Stoke-on-Trent, we've seen recent statistics showing that people taking their own lives are double the national averages. And that's why I'm proud to support a cross-party campaign, the No Time to Wait campaign led by James Starkey, with the backing of the Telegraph and the Royal College of Nursing, to create a provision of mental health nurses in GP surgeries, which can make a real difference to those who bravely come forward asking for help. Would my right honourable friend meet with me, members in this House are supportive, and James, to discuss how we can make this possible?
Yes, of course, Mr. Speaker. I'd be delighted to meet with my honourable friend and with others to discuss this campaign. And I know my honourable friend speaks with passion. It's something that he's long campaigned on, and I have had time to look at some of the content of this campaign, but I would certainly be happy to discuss it further.
Dr. Alan Whitehead.
Thank you. Number 6, Mr. Speaker.
Minister.
Thank you very much, Mr. Speaker. Reducing waiting lists and waiting times, exacerbated, of course, by the impact of the pandemic, is a key priority for this government. Southampton, like the rest of the country, will benefit from the detailed actions set out in the elective recovery plan published by my right honourable friend, the Secretary of State, a few months ago. And in addition, as part of Solent Acute Alliance's hospital upgrade programme, the University Hospital Southampton NHS Foundation Trust has received £12.1 million to increase capacity at Southampton General.
Dr. Alan Whitehead.
In speaking with the Hospital Trust in Southampton, which is an excellent provider, they are desperate to get back to elective surgery and non-life-threatening procedures, but find they cannot, because they cannot integrate COVID treatment into general ward activities, and they have a continuing high level of staff sickness, which means that procedures are often undertaken very inefficiently in terms of resources. What assistance can the Minister provide for Southampton University Hospital Trust to enable them to get on the front foot as far as elective procedures and non-life-threatening treatments are concerned in the near future?
Minister.
Well, I'm grateful to the honourable gentleman. He quite rightly pays tribute to the staff at his hospital trust, and I join with him in doing that. We've seen the number of those waiting in his area for an elective procedure or routine operation reduce slightly. There's more to do, but they are making inroads, as he says. I know they want to do more. As we set out in the elective recovery plan, some innovations, such as, for example, surgical hubs, which allow a greater separation between COVID areas or areas where COVID may be present and elective activity, is a key part of that. But if it's helped him, I'm always very happy to meet him to discuss the specifics of his local hospital.
Ian Lavery.
Question number 7, sir.
Minister.
Thank you, Mr. Speaker. The Government is committed to tackling poor quality housing. In the Social Housing White Paper, we committed to a review of the Decent Home Standard to test whether it is up to date and reflects current needs and expectations. The Levelling Up White Paper sets out a commitment to halve levels of non-decency in all rented homes by 2030, with the biggest improvements in the poorest performing areas. These reforms will have a positive impact on health, and we work closely with the Department of Levelling Up Communities and Housing to support their implementation.
Thanks, Mr. Speaker. The NHS spends a staggering £2.5 billion plus annually treating people with illnesses directly linked to living in cold, damp and dangerous conditions. And as a consequence, severe respiratory disease like asthma, and might I mention mesothelioma and other asbestos-related diseases are on the increase, mainly in the most deprived areas. More and more people are sadly dying, Minister. Can you say how the government's levelling up policy plans to tackle this increasingly urgent health issue?
Thank you, Mr. Speaker. And the Honourable Gentleman raises a really important issue, and it's something that we're determined that we'll tackle. Housing is one of the key determinants of health, and a decent home can promote good health and protect from illness and harm. And we know, as the Honourable Gentleman said, that poor housing conditions have serious consequences for mental and physical health. And that's why we're determined, not just through the Levelling Up White Paper, but through the Health Disparities White Paper that will be published later this year, that will set out a bold ambition to reduce the gap in health outcomes and the actions that the government will be taking to address the wider determinants of health, including housing and the impact of poor housing on health.
Lynn Saxby.
Thank you, Mr. Speaker, and I thank my honourable friend for her answer. In North Devon, it's not just the quality of housing that's causing health issues, it's a lack of availability of affordable housing and a complete collapse of the private rental sector, which is delivering mental health issues amongst my constituents, but also means my much-loved North Devon Hospital is struggling to recruit as a local medical services. What steps is the department taking to try and address these concerns?
Minister.
Thank you, Mr. Speaker. And my honourable friend raised an important issue specific to her area and other areas that attract the people who go there for their holidays and perhaps not there on a permanent basis. But we're determined that through our white papers that we address every health inequality, whether it's caused by a population that is a movable population or whether it's a static population in the sort of areas that the honourable gentleman previously talked about.
Bobby Perkins.
Number 8, sir.
Minister.
Thank you, Mr. Speaker. Cancer treatment and diagnosis remained a top priority throughout the pandemic, with 4.4 million urgent referrals during the period and over 1 million people receiving cancer treatment. Thanks to the brilliant work of our NHS staff, first treatments for cancer have been maintained at above 94% of usual levels over the course of the pandemic. However, we do know fewer people came forward, and so we are now seeing record numbers of people coming through the system, with November last year having the highest number of 11,000 cancer referrals per working day.
Toby Perkins.
Thank you, Mr. Speaker. I asked specifically about Derbyshire. I didn't get an answer in terms of that. But Derbyshire CCGs failed to reach any of the cancer referral targets for the most recent 12 months. And whilst this is a national failure, these shortages are particularly acute in Derbyshire. These failures have tragic consequences. My constituent, Paul Bryan's just 58. He's been attending his surgery for 2 years. He kept getting dismissed. He wasn't tested. And now the prostate cancer that was undiagnosed for all that time has spread to his ribs, to his spine, to his bones, and his diagnosis is terminal. His family are urging the government to show more urgency to improve outcomes so that other families don't have to experience this needless heartbreak that they are. So can the Minister explain to the Bryans why the government rejected the workforce planning amendment to the Health and Care Bill, which could help our NHS get the cancer specialists it needs and prevent other families having this heartbreak like the Bryans?
Well, I'm sorry to hear about the case of the Bryan family, but can I reassure him in Derby and Derbyshire that the start of treatment within 31 days is at 92%, and that's despite record numbers of patients coming forward. And to tackle the very issue that he talks about getting people diagnosed earlier, because that's the key to getting more successful treatment, we are rolling out rapid diagnostic centres across the country so people can access screening and testing much more quickly and much more easily, and we have 159 of those live right now, with more to follow.
Davidson.
Number 9, Mr. Speaker.
Same state.
Mr. Speaker, personalised healthcare is a key priority in my reform agenda. I recently set out a new ambition that as many as 4 million people benefit from personalised care by 2024, covering everything from social prescribing to personalised support plans. And we are also on track to deliver 200,000 personal health budgets and integrated personal budgets by 2023-24.
Well, thank you, Mr. Speaker. I welcome the Secretary of State's answer. My constituents do still tell me that they are experiencing some delays beyond the NHS guidelines when it comes to diagnosis for special treatment. So what plans does my right honourable friend have to address, in particular, a lack of capacity and a need for capacity in specialty trained doctors and specialist diagnostic equipment to make personalised care a reality?
So state.
My honourable friend is absolutely right to raise the importance of the workforce and medical equipment. He will be, I'm sure, reassured to know that the NHS today has more doctors and nurses working for it than ever before, with more in training than ever before, and we're investing record amounts in capital for new medical equipment, including investment in some 160 new community diagnostic centres, which will all include the latest state-of-the-art diagnostic equipment.
Adam Kaiser.
Number 10, please, Mr. Speaker.
Minister.
Thank you, Mr. Speaker. NHS England has several bespoke services for veterans. This includes Op Courage, the Veterans Mental Health and Wellbeing Service, which provides a complete mental health care pathway for veterans. And veterans can benefit from personalised care plans, ensuring they can access support and treatment both in and out of hours. And as part of the care and support available to veterans, Op Courage works with military charities and local organisations to provide health with wider health and wellbeing needs, including drug and alcohol addiction.
Thank you, Mr. Speaker. My constituency of Airdrie Shots has a long military history, with many previously serving in the armed forces. And when I meet veterans from my constituency, we often discuss the mental health of veterans. And the war in Ukraine will undoubtedly have an immediate and lasting impact on the mental health of veterans, as they may be reminded of their experiences of war. So to help support our veterans, will the Department come forward with a package of emergency funding for armed forces mental health charities?
Minister.
Well, the Honourable Lady raises a very good question, and last year we committed an additional £2.7 million to further expand Op Courage following the recent events in Afghanistan. And NHS England has put in place several bespoke services and initiatives to meet the needs of our armed forces community. In addition to Op Courage, there is also the Veterans Trauma Network, the Veterans Prosthetic Panel and the Veteran GP Accreditation Scheme. But of course, with the ongoing events in Ukraine, of course, we will keep everything under review, and I'm very happy to meet with her to discuss further what may be required in this area.
We now come to Shadow Minister Dr. Rosanna Allen-Carr.
Thank you very much, Mr. Speaker. Our veterans have risked their lives for our country and deserve excellent mental health support. We must go even further. From the military frontline to frontline workers who have kept us safe, everyone deserves proper mental health provision. People have stepped up to protect our country and save lives during the pandemic. So is it any wonder then that teachers and NHS staff are so furious with the comments made by the member for Lichfield that they would go back to the staff room and have a quiet drink as a way to justify the indefensible actions of the Prime Minister? What does this say about the effect of mental health on our frontline staff? And will the Minister please condemn these comments and apologise for the hurt caused by these remarks.
Minister.
I'm very happy to say that we, of course, thank very much all of the staff that have been on the front line, whether they're veterans, whether they're teachers, involved in everything that kept us going throughout the pandemic. And of course, the stresses and strains and the impact on mental health is something that we're very much aware of. There is additional support for mental health, and there will continue to be additional support with young people's mental health, with adult mental health. But of course, that's one of the reasons why we launched a call for evidence last week to inform a new 10-year cross-department mental health vision. And I would urge everybody actually to input into that process before it closes on the 5th of July.
Mr. Black.
11, please.
Thank you very much, Mr. Speaker. The workforce is the heart of our NHS, and I join with my honourable friend, and indeed I know with opposition members as well, in paying tribute and putting on record our thanks to those who work in the NHS. In the short term, the NHS has well-established processes to ensure the health service has the right number of staff with the right skills, alongside, of course, our investment in workforce expansion, including delivering 50,000 more nurses over the course of this Parliament. For the longer term, we have commissioned Health Education England, set out key drivers of workforce supply and demand. They're due to report this spring, and building on this, my right honourable friend, the Secretary of State, commissioned NHS England to develop a long-term workforce framework. We will share the conclusions in due course.
Kirsty Blackman.
Very much. The anti-immigration hostile environment rhetoric and actions of this government means that it's having a significant impact on our NHS workforce, both in encouraging or not encouraging people to come here to work in our NHS, but also in discouraging current staff from staying here. The Health and Social Care Committee recommended that a national policy framework on migration to support national and local workforce planning be brought in. When will the government implement this recommendation?
Well, I'm very grateful to the honourable lady for her question. We are clear, and always have been clear, in how much we value the huge contribution that overseas workers in our NHS play in keeping our health service up and running and in delivering first-class care every day. There are three strands to our approach to building our workforce and increasing our workforce. One of them is increasing the numbers of people training in this country. A second is increasing retention, and a third is that workforce that comes from overseas and is incredibly welcome here. And I have to say that the number of people coming from countries outside of the EU into our NHS workforce has increased.
Anne-Marie Morris.
Thank you, Mr. Speaker. The Minister will be aware that the particular challenge for rural areas of developing a workforce plan are something which I have highlighted on a number of occasions. Indeed, the last report from the APPG on rural health and social care put forward 10 recommendations which included how we might address the workforce planning issue in rural areas. Could the Minister advise me what steps he's taken to put in hand any of those recommendations to improve the plight of those living in rural areas?
Minister.
Thank you, Mr. Speaker. Well, I'm grateful to my honourable friend, who I know takes a close interest in this issue. She and I have discussed it on a number of occasions. And she's right to highlight the challenges that some more remote or rural communities can face in securing the workforce they need to meet their communities' needs. That is one of the things that I know that HEE work and subsequent workforce framework will be looking at across the whole range of geographies and the challenges faced by different geographies.
SNP spokesperson Martin Day.
Thank you, Mr. Speaker. The Scottish Government has recently bought Carrick Glen, a private healthcare hospital, in order for it to become part of the national network of treatment centres, which once fully operational will deliver capacity for over 40,000 additional surgeries and procedures each year. In contrast, the UK Government has taken the path of further privatisation of the NHS. So what recent assessment has the Minister made of the impact on workforce of further privatisation of NHS England?
Thank you, Mr. Speaker. Well, I'm grateful to the honourable gentleman. Had we been going further down the route of privatisation, perhaps the honourable gentleman's question might have had a little more resonance. What we have done in the NHS in England is investing in our workforce, investing in our national health service, while, of course, working closely with the independent sector to maximise the use of their capacity in parallel to make sure we bring down waiting lists and waiting times.
We now come to topicals. Lawrence Robertson.
Topical question number 1, Mr. Speaker.
Stay.
Thank you, Mr. Speaker. Our healthcare system is standing at a crossroads, and sooner or later we will have to make a choice between endlessly going back to the taxpayer to ask for more money and reforming the way in which we do healthcare in our country. Last month, I unveiled an ambitious new programme for reform, setting out how we are going to prioritise prevention, offer more personalised care, deliver improvements in performance and back the people making the difference in the NHS. The objective of this agenda, Mr. Speaker, is simple: to bring about the biggest transfer of power and funding in decades from our ever-expanding state to individuals, their families and their communities.
Robertson.
Thank you, Mr. Speaker. In Gloucestershire hospitals, 30% of patients do not medically need to be in hospital awaiting for discharge. That figure is twice the national average. Will one of the ministers contact the relevant people in the health service in Gloucestershire to ask them ways in which the government could help them to reduce that figure, because as it stands, lives are being put at risk?
Mr. Speaker, my honourable friend is right to raise this, and we are already in contact with the Acute Trust in Gloucestershire and some of the other trusts that are finding delayed discharge a particular challenge. My honourable friend will know that because of the pandemic, what has been a long-term challenge has become much more acute, not least because of the lost beds due to infection protection control and staff absences, both in healthcare and in social care. Our delayed discharge task force is making a difference. Numbers are coming down overall, but we will be working with Gloucestershire.
Secretary of State West Street.
Thank you, Mr. Speaker. Why does the Health Secretary think he has any licence to lecture the British people on their moral duty to pay taxes when he spent so many years avoiding his own?
Mr. Speaker, we want.
I'm not quite sure it's relevant to the question of topicals.
Responsibility of Secretary of State, not personal.
Yes, questions meant to be addressed.
I'm very happy to answer, if you allow me, because look, the honourable gentleman, he could have asked me a question on anything to do with health and care, anything he wanted, but instead he chooses to talk about my personal affairs before public life. That was his choice. He could have asked me, Mr. Speaker, he could have asked me about the COVID backlogs that he pretends that he cares so much about. He could have asked me about how, perhaps given me suggestions.
Order. Secretary of State, just say, I've got it. There are questions and your responsibilities. No, we can have another try. West Street.
Thank you, Mr. Speaker. I'd just say to the Secretary of State, be careful what you wish for. I hope he will at least reply to the letter I sent him last Thursday. I'll place a copy in the library of the House. He's been stonewalling journalist questions, but since he says he wants to talk about the government's record, let me ask him about that instead. Because we went into the pandemic with NHS waiting lists already at 4.5 million. We went into the pandemic with NHS staff shortages of 100,000. We went into the pandemic with social care staffing vacancies of 112,000. So it isn't just the case the Tories didn't fix the roof while the sun was shining. They dismantled the roof, removed the floorboards, and now they have no plan to fix it. So where is the Secretary of State's plan to fix the NHS crisis?
Once again, I'll remind that topicals are short and punchy, not lengthy statements rather than a question. Now, I just want to say there's a lot of backbenchers on both sides who deserve to get in, who want to raise constituency matters. Please, let's give them time. I don't want a lengthy fallout, and they are health questions. Secretary of State.
Mr. Speaker, you've been very generous to the honourable gentleman, but another try you gave, but another failure in asking a question. Again, he's not talking about the serious issues, and it shows once again that he will play petty party politics. Labour has no plan for the challenges that this country faces.
Can I just reassure the Secretary of State for Health? I wasn't being generous. The actual Shadow Secretary of State did have 2 questions, so I've not been generous in any shape, way or form. Mark Fletcher.
Mr. Speaker, we've all seen the disturbing scenes in Shanghai recently, and does my right honourable friend agree that this shows how dangerous a zero-COVID strategy is, and that we were right to open up this country and to rely on our vaccines as the safest way out of the COVID situation?
Mr. Speaker, like many across the House, I've been deeply disturbed by the reports that we've all seen from Shanghai, and my thoughts are with the people that are affected. It does show what dangerous fallacy this whole idea of zero COVID was, and it does also show the fact that we are the most open country in Europe, that we've got the big decisions right. We didn't listen to the party opposite when they said we shouldn't open up in the summer. We didn't listen to the party opposite when they said in the winter, again, calling for restrictions. We are showing the world in how to live with COVID.
Thank you, Mr. Speaker. My constituents are being forced onto private and unaffordable dental plans or wait up to 5 years to see an NHS dentist. The situation is getting worse and worse. So I've met with the groundbreaking Hull and York Medical School to see if they can assist with training a future generation of dentists. They are keen to help. So what is the Minister doing to work with medical schools?
Well, we've got to get others in.
I thank the Honourable Lady for her question. We have met to discuss this previously. I'm happy to discuss with Health Education England to see if one of their centres for dental development could be suitable for her constituency.
Peter Byrne.
In 2019, Kettering General Hospital, which serves my constituency, was promised £46 million for a major upgrade. 3 years later, the hospital still hasn't got the money. Secretary of State, can you go out and buy a very, very, very big pair of scissors, cut through the red tape and get it sorted?
Well, I'm grateful to my honourable friend. No one, with possibly the exception of the honourable member for Kettering, is more passionate about seeing the improvements at his local hospital delivered, and I had the pleasure of visiting. The £46 million, he will know, was allocated originally for an urgent treatment centre. The hospital asked that that be changed, and it folded in with the overall programme. They have yet to submit a business case for the enabling works. When they do, I will ensure it is expedited.
Lloyd.
Thank you, Mr. Speaker. The gap in life expectancy between people living in the richest and the poorest areas is once again growing. That affects my constituents directly. I've heard nothing today that tells me what the Secretary of State is going to do to narrow that gap. So, Secretary of State, what will you do to protect my constituents?
Mr. Speaker, the honourable gentleman knows that I know his constituency well. It's my birthplace, and he may know also just a couple of months ago I visited his constituency and I met with members of the local community at the Deeplish Community Centre to talk about exactly what he's rightly raised today, the importance of tackling inequalities in Rochdale and beyond, and that will be set out, our plans, in our upcoming health disparities white paper.
James Sunderland.
Mr. Speaker, thank you. The CAS Review interim report found that to date there's a profound lack of evidence on the best approach to treat gender dysphoria in children. Does my right honourable friend share my concern that in spite of this, the NHS insists on making a child's express gender identity the start point for treatment, and also my surprise that the NHS has chosen so far not to track patient outcomes, particularly for under 18s?
Mr. Speaker, I do share my honourable friend's concerns, and that is why the NHS commissioned this review from one of our top paediatricians. It is already clear to me from her interim findings and for the evidence, other evidence that I've seen, that the NHS services in this area are too narrow, they are overly affirmative, and in fact they're bordering on ideological. And that is why in this emerging area, of course, we need to be absolutely sensitive, but we need to make sure that there is holistic care that's provided, that there's not a one-way street, and that all medical interventions are based on the best clinical evidence.
Bill Rivera.
Thank you, Mr. Speaker. Since February 2020, my local borough of Lambeth has seen a 14% drop in dementia diagnosis. Now, that just means that people aren't getting the support that comes with diagnosis. We also know that so far none of the announced £8 billion backlog funding has been dedicated to addressing the stagnation of diagnosis rates. So can the Secretary of State explain to us exactly what they're going to do to make sure that people are getting diagnosed on time?
The Honourable Lady raises a very important question. We want a society where every person with dementia, their families and carers receive high-quality care, compassionate care from diagnosis through to end of life. We have provided £17 million this financial year to NHS E&I to increase the number of diagnoses. And this funding was spent in a range of ways, including investing in workforce to increase capacity in memory assessment services.
Speaker,
the Secretary of State will have read the scandal exposed in the Sunday
Times this weekend that 6 babies are being born every month after being exposed to sodium valproate, which has been known for many years to cause disabilities. Last year, the government consulted on putting warning labels on valproate. Is it not time to go much further and ban the prescription of sodium valproate to epileptic pregnant mothers?
Mr. Speaker, my right honourable friend is right to raise this, and many of us would have seen the recent reports on this, especially from the families affected. It is right that we reconsider this and that we make sure that whether it's sodium valproate or any other medicines, that they are only given in the clinically appropriate settings.
Toby Perkins. Thank you, Mr. Speaker. The Secretary of State is right that there's many important health matters that we all want to get to the bottom of, and we don't want his, what he described, personal affairs to get in the way of that. So would he, in order to ensure this House concentrates entirely on those matters, welcome the HMRC investigating whether he was claiming non-dom status on a solely...
Order. Let's move on. What a waste of a question. Jenna Davidson.
Thank you, Mr. Speaker. I'll try not to make this one a waste. I was very grateful to the Minister for meeting me to discuss my ongoing campaign to restore the A&E to Bishop Auckland Hospital. Yeah. Many of my constituents face huge drives to get to Darlington or Durham, and given that swift treatment can be a significant factor in outcomes for a number of conditions like strokes and heart attacks, would he agree with me that having A&E services spread geographically rather than just in strong population centres is an essential part of keeping our communities safe?
Hear, hear.
Thank you, Mr. Speaker. Well, I'm grateful to my honourable friend. I did indeed have a very positive and constructive meeting with her. It's absolutely right that we have access geographically spread to A&E services, but these decisions are quite rightly taken by clinical commissioners on the basis of clinical evidence. But I know she will continue fighting the corner for the reopening of her local A&E with tenacity and passion.
Dodson.
Mr. Speaker, the 10-year cancer plan the Secretary of State has announced is a key opportunity to ensure that future services are designed with the patient at its core, especially for those living with cancer. What steps is his department taking to engage with underrepresented groups in the development of the 10-year cancer plan? And will you agree to meet with Macmillan Cancer Support to discuss how they can support in this key area?
Mr. Speaker, I would pleased to have that meeting that the Honourable Lady has suggested, and she should know the 10-year cancer plan. We've just closed the consultation. There's been a fantastic response to the consultation. She may also have seen the announcement we made today around the lung cancer health checks, and it's with improvements like that we intend to do a lot more.
Edwards.
One of the best ways to maximise NHS capacity is to increase people's access to GP appointments and treatments like mental health services and physiotherapy in their own community. So would the Minister join me in backing our bid for a new health centre in Eastleigh and in calling on Nottinghamshire's Clinical Commissioning Group to prioritise funds for this vital service?
I thank the Honourable Lady for her question. I did an excellent visit to the surgery in Eastleigh, and I look forward to the business case being submitted so we can look at it further. She's quite right. Investing in primary care does a huge amount to support the health of the local community.
Ella Days.
Thank you very much, Mr. Speaker. A survey by the charity STEM4 has found that 95% of GPs believe CAMS services are in crisis, with children and young people waiting up to 2 years for treatment after referral. Will the Secretary of State stop treating children as an afterthought and act to provide open access mental health hubs for young people in every community to put an end to these agonising waits?
The Honourable Lady raised a very important point, and I know that children's mental health services are treating more young people than ever. However, the demand has quadrupled since the pandemic, and we know that's why we've invested £79 million in these services, and by 2023-24 an extra 345,000 more young people will be accessing support. I mentioned the call for evidence. I think it is very important that we work through our vision for our 10-year plan. We're also introducing mental health support teams in schools, which will help, plus access to community and mental health hubs, and more young people access to eating disorder services, but there's a lot of work ongoing.
Thank you, Mr. Speaker. I know from discussions with constituents that needle phobias are a real thing. Can my right honourable friend therefore tell the House what support the government is giving to intranasal vaccine delivery systems to ensure that the maximum number of people take up the vaccine?
Thank you, Mr Speaker. The Department for Health and Social Care commissions research through the National Institute for Health and Care Research, which the UK Research Innovation has co-funded the Imperial College London study worth £580,000, looking specifically at the safety and effectiveness of 2 COVID-19 vaccines administered via the respiratory tract. This study is ongoing, but in later stages of the Phase 1 clinical trial, and results will be made public in due course and following peer review.
Thank you, Mr. Speaker. Those doing social care often work long hours as a real lifeline for the most vulnerable. Will the Minister act to ensure those in social care are paid properly and paid a real living wage, as Citizens UK is campaigning for?
I thank the honourable gentleman. Actually, according to Skills for Care data from 2020-21, the majority of care workers were paid above the national living wage in that year. Most care workers are employed by private sector providers who pay their terms and conditions. However, we are committed, and we have committed £1.36 billion to Market Sustainability and Fair Cost of Care Fund, which will support local authorities to move towards paying providers a fair cost of care, which we hope will lead to better sustainability and better staff.
Thank you, Mr Speaker. At Prime Minister's questions, I have raised a local campaign for a specialist menopause clinic in Devon. I'm pleased the Minister has agreed to meet with me. Will my right honourable friend encourage local NHS leaders to fund specialist menopause services?
I thank my honourable friend for his question. The Government recognises that menopause services are needed to improve, which is why menopause is a priority area in our women's health strategy. We also recognise that it's often best provided in primary care, but some women do need some specialist services, and we are looking at this in our women's health strategy and also the menopause task force as well.
Kate Osborne.
Mr Speaker, in December last year, the Department of Health and Social Care promised 3 urgent actions to tackle the gender health gap: the appointment of a Women's Health Ambassador, legislation to ban hymenoplasty, and that the Women's Health Strategy for England would be published in the spring of 2022. So can I ask the Minister, when are these vital actions actually going to happen?
I can let the honourable lady now know that interviews have taken place for the Women's Health Ambassador. We're expecting an announcement on the appointment any day now, and we will be publishing the Women's Health Strategy in the coming weeks.
Sir David Evans.
Thank you, Mr Speaker. Can I welcome all my right honourable friend is doing to address health inequalities? However, could I ask him to look carefully at public health funding for my borough of Bexley, whereas we're seriously underfunded compared to similar boroughs in London?
I'm very pleased to meet with my honourable friend and to discuss that further, and I'm sure also he will welcome the publication of the upcoming Health Disparities White Paper.
Final question, Kim Glenn-Beater.
Thank you, Mr Speaker. In a recent survey by Carers UK, almost half of unpaid carers said that they are currently unable to manage their monthly energy bills and expenses, and any further increases will negatively affect their own physical and mental health or that of the person they care for. So what steps are being taken, along with the Secretary of State for Work and Pensions, to support these hard-working, exhausted, unpaid carers with the cost of living?
I thank the honourable lady for her question, and of course we have a great deal of gratitude for every unpaid carer. Around 360,000 carer households on universal credit can receive an additional £2,000 a year through the carer element. The weekly rate of carers allowance increased to £69.70 in April 2022, and we've also had a real terms expenditure on carers allowances forecasted to increase by around £1.3 billion. In addition, there are a big focus in our reforms and our white paper to focus on what more we need to do to support unpaid carers.
We now come to the statements, in which I will call the Home Secretary. Home Secretary Priti Patel.
Thank you, Mr Speaker. With permission, Mr Speaker, I'd like to make a statement on the United Kingdom's approach to the global migration challenge. The United Kingdom has a long and proud history of offering sanctuary to refugees. In recent years alone, we have welcomed more than 185,000 people through safe and legal routes, including from Syria, Hong Kong, Afghanistan, and more recently, Ukraine. In addition, we have welcomed more than 40,000 people in recent years through our refugee family reunion routes. This government has done more than any other in recent history to support those fleeing persecution, conflict or instability. But we cannot focus our support on those who need it most or effectively control our borders without tackling illegal migration, which, Mr. Speaker, is facilitated by people smugglers, serious organised criminals that profit from human misery, who do not care about people drowning in the Channel or suffocating in the back of containers. We must break their lethal and evil business model by removing the demand for their repugnant activities. This type of illegal migration puts unsustainable pressures on our public services and local communities. Every day, the broken asylum system costs the taxpayer almost £5 million in hotel accommodation alone. The cost of the asylum system is the highest in over 2 decades at over £1.5 billion. And as the Prime Minister, Mr. Speaker, said last week, we cannot sustain a parallel illegal system. Our compassion may be infinite, but our capacity to help people is not. But this is why the new plan for immigration and its legislative vehicle, the National Anti-Borders Bill, are so vital. And once again, I urge honourable members, but also members in the other place, to follow this elected House in backing the bill. At the heart of this government's approach is a simple principle, Mr. Speaker: fairness. Access to the UK's asylum system should be based on need, not on the ability to pay people smugglers. Mr. Speaker, more than 80 million people around the world are displaced. Others are on the move because they want a better life. There is a global migration crisis that demands innovative and international solutions, and this government is taking firm action. When I published the new plan for immigration back in March last year, we set out 3 very clear objectives: to increase the fairness and efficacy of our system so that we can better protect and support those in genuine need of asylum; to deter illegal and dangerous routes of entry to the UK, thereby breaking the business model of criminal smuggling networks and protecting the lives of those they endanger; and, Mr. Speaker, to remove more easily from the UK those with no right to be here. The Ministry of Defence has taken command of small boat operations in the Channel. Every small boat incident will be investigated to determine who piloted the boat and could therefore be liable for prosecution. These reforms are a truly cross-government effort, including the Home Office, the MOD, the Crown Prosecution Service, Border Force and the Ministry of Justice. A nationwide dispersal system will be introduced so that asylum pressures more equally spread across local authorities. Currently, 53% of local authorities in England, Scotland and Wales do not accommodate asylum seekers under the dispersal system. It is simply unfair that a national burden should be felt disproportionately by certain areas of the country. For the first time, Mr. Speaker, the government is building asylum reception centres to end the practice of housing asylum seekers in expensive hotels. A new reception centre in Linton-upon-Ouse in North Yorkshire will open shortly. Far from being outlandish, as some of the opposition have commented, asylum reception centres are already operational in safe EU countries, such as Greece, Mr. Speaker. And, Mr. Speaker, they are funded by the EU. And just last week, I signed a new world-leading migration and economic development partnership with Rwanda. Under this partnership, those who travel to the UK by illegal and dangerous routes, including by small boats across the Channel, may be relocated to Rwanda, where they will have their asylum claims considered. Those in need of protection will be given up to 5 years of support, including education and employment training, help with integration, accommodation, healthcare, so that they can thrive there, Mr. Speaker. The UK is supporting this investment in Rwanda over 5 years, boosting the Rwandan economy and increasing the opportunities of people living there, further cementing the trading and diplomatic relationship between our countries. Mr. Speaker, this is a bespoke international agreement reached last week with Rwanda. I came to Parliament as soon as was reasonably practical following the conclusion of that agreement. This agreement is comparable with all our domestic and international legal obligations. Rwanda is a state party to the 1951 United Nations Refugee Convention and the 7 core United Nations Human Rights Convention, and has a strong system for refugee resettlement. The United Nations has used Rwanda for several years to relocate refugees, Mr. Speaker. And, of course, Mr. Speaker, it was the European Union who first funded this. This agreement deals a major blow to the people smugglers and their evil trade in human cargo. Everyone who is considered for relocation will be screened and interviewed, including an age assessment, and have access to legal services. Mr. Speaker, in relation to accounting officer advice, contrary to reports in the newspapers, the Permanent Secretary did not oppose this agreement nor assert that it is poor value for money. Rather, he stated in his role as accounting officer that the policy is regular, proper and feasible, but there is not currently sufficient evidence to demonstrate value for money. It is the job of ministers to take decisions, Mr. Speaker, and it is the job of ministers, Mr. Speaker, more often than not, to take tough decisions in the interests of our country. Existing approaches, Mr. Speaker, have failed, and there is no one single solution to tackle these problems, something that I think the benches opposite may have encountered in the past as well. Change is needed because people are dying attempting to come to the UK on illegal and dangerous routes. This partnership is a type of international cooperation needed to make the global immigration system fairer, keep people safe and give them opportunities to flourish. This will help break the people smugglers' business model and prevent the loss of life while ensuring protection for those who are genuinely vulnerable. This government is delivering the first comprehensive overhaul of the asylum system and this type of illegal migration in decades. At the heart of this approach, Mr. Speaker, is fairness. Access to the UK's asylum system must be based on need, not the ability to pay people smugglers. And the demands on the current system, the cost of British taxpayers and the scandalous abuses are increasing. The British public have rightly had enough. Our new plan for immigration will improve and support those directly fleeing oppression, persecution and tyranny through safe and legal routes. It will deter illegal and dangerous routes of entry to the UK, make it easier to remove those with no right to be in the UK, and, Mr. Speaker, provide a common-sense approach to controlling immigration, both legal and illegal. I commend the statement to the House.
I call the Shadow Home Secretary, Yvette Cooper.
Thank you, Mr. Speaker. We've seen over the last week, Mr. Speaker, this unworkable, shameful and desperate attempt to distract from the Prime Minister's law-breaking that the Home Secretary should not go along with because she is undermining not just respect for the rule of law, but also her office by providing cover for him. The policies that she has announced today are unworkable, unethical and extortionate in the cost for the British taxpayer. There's no information from the Home Secretary about the costs today. Will she admit the 120 million she's announced doesn't pay for a single person to be transferred? She hasn't actually got an agreement on the price for each person. In fact, the £120 million is the eye-watering price the Home Office is paying just for a press release. So what's the rest of the cost? What is this year's budget? How many people will it cover? The Home Office has briefed it might be £30,000 per person to cover up to 3 months' accommodation, but that is already 3 times more than the ordinary cost of dealing with an asylum case in the UK, and her statement says she's going to provide 5 years of cost. Well, in Australia, offshoring costs £1.7 million per person. That is over 100 times more than the ordinary asylum cost from here. So where is all the money going to come from in order to fund this plan? She says she's going to save money on hotels, but the only reason we're paying a fortune in hotel costs is because the Home Office decision-making has totally collapsed. On her watch, Home Office are only taking 14,000 initial asylum decisions
a year. That is half what they were doing 5 years ago, half. Taking fewer decisions than Belgium, Netherlands, Austria, never mind France and Germany. So the costs to the UK taxpayer have soared by hundreds of millions of pounds because she isn't capable of taking the basic asylum decisions. And because she's not capable of taking those decisions, she is trying to pay Rwanda to take those decisions instead. Whether people are refugees or not, whether they are victims of modern slavery or not, whether they have family in the UK, whether they've come from Afghanistan, Syria or even Ukraine. She is asking them to do the job that she is not capable of. She says it will deter boats and traffickers, but the Permanent Secretary says otherwise. He says there's no evidence of a deterrent effect, and there has been a total failure to crack down on criminal gangs that are at the heart of this problem. The prosecutions for human trafficking, for non-sexual exploitation, are down from 59 in 2015 to just 2 in 2020. Just 2. Well, the criminals won't be deterred because someone they exploited was sent to Rwanda. They don't give money-back guarantees, which means they lose money if their victims end up somewhere else instead. They will just spin more lies, and she is totally failing to crack down on those criminal gangs. So why not get on with her basic job instead? Properly crack down on human traffickers. Do the serious work with France and Belgium to prevent the boats setting off instead. She didn't even mention in this statement, and make decisions fast. The Home Secretary is just using this policy to distract from years of failure. She promised 3 years ago to halve the number of crossings, and instead they have increased tenfold. And this will make it worse for trafficking. The top police chief and modern slavery commissioner has said her legislation will make it harder to prosecute traffickers. When Israel tried paying Rwanda to take refugees and asylum seekers a few years ago, independent reports showed it increased people smuggling and increased the action of the criminal gangs. And that is the damage she is doing. She is making it easier for the criminal gangs and harder for those who need support. At a time when people across our country have come forward to help those who are fleeing Ukraine, to help desperate refugees, instead of working properly with other countries, the Home Secretary is doing the opposite. All she is doing is making it easier for the criminal gangs. So will she tell us the facts, the real costs of this policy, the real damage it's going to do to human trafficking and people smugglers, and come clean with the public and come clean with the House?
Home Secretary.
Thank you, Mr. Speaker. Well, Mr. Speaker, I should just say that response was just somewhat wholly predictable, if I may say so. And I think it's important just to say to everyone in the House right now, you cannot put a price on saving human lives. And I think everyone will respect that completely. And, Mr. Speaker, if I may, the Honourable Lady was a minister in the Blair government when the powers that have given this government to undertake the legal basis of this policy were introduced back then. And I don't remember the current Home Secretary, Shadow Home Secretary, exploding in this synthetic rage when she occupied a seat in the Blair government, when all those policies were put in action. And those, Mr. Speaker, were acts passed in 1999, 2002, 2004 for partnerships in this similar way. By the way, the same partnerships and that were used to put in place the Dublin regulations to return inadmissible asylum seekers to EU member states. And of course, the Honourable Lady has gone on the record multiple times to attack the government for leaving those regulations, while at the same time calling for a replacement to be put in place. Now she's attacking the government for using the very powers that only a few weeks ago she was saying that we still could be using if we hadn't left the EU. I think, quite frankly, Mr. Speaker, what we've seen today from the party opposite and from the Honourable Lady is, quite frankly, their absolute inability to understand this issue, this differentiation between legal migration and illegal migration. They should be honest about their policies. Their position is to stand for open borders and uncontrolled immigration. And, Mr. Speaker, if I may just go even further, I mean, she speaks about the policy being unworkable and then extortionate. Well, if the policy is unworkable, it can't then be extortionate because we'll be making payments based on delivery. And this is the point about our scheme, that there is nothing that she has said today that actually puts an alternative forward, that actually seeks to deal with the issue of people trafficking, deaths in the Channel, and importantly, I think the Labour Party being exposed today for having no policy, no idea as to stop people smuggling.
Theresa May.
Thank you, Mr. Speaker. Can I say, with respect to my right honourable friend, that from what I have heard and seen so far of this policy, I do not support the removal to Rwanda policy on the grounds of legality, practicality and efficacy. But I want to ask her about one very specific issue. I understand that those who will be removed will only be young men, that families will not be... well, the Home Secretary is shaking her head, so I've obviously misunderstood the policy in that sense. But if it is the case that families will not be broken up, and the Home Secretary is nodding, does she not believe, and where is her evidence, that this will not simply lead to an increase in the trafficking of women and children?
Mr. Speaker, I'm very happy to meet with the Right Honourable Lady to discuss this further and actually give her further information on this. No, actually calm down and listen. I think first and foremost, just on the policy is legal, and there's been a published MOU that speaks very, very clearly, well, you're not even listening, so there's no point to it. That spells out the MOU very clearly in terms of the legal. If you're interested in listening to responses, then please do. That there is an MOU that has been published which spells out in full detail the legalities, but also the nature of the agreement. Now, I think the Right Honourable Lady would respect the fact that I'm not going to come to the floor of the House and speak about the eligibility criteria, because she will know. Because actually, if I may say so, Mr. Speaker, the Right Honourable Lady will know very, very well that actually it's that type of criteria that is used by the smuggling gangs to then effectively exploit various loopholes in our existing laws when it comes to various issues such as legal action that is undertaken to prevent removals, some of which, if I may, Mr. Speaker, just add, there are many members opposite that write letters to me frequently to say, please don't remove some of the failed asylum seekers, but also foreign national offenders, people that have actually got no legal basis to remain in our country. But I'd be happy to meet with the Right Honourable Lady on
Spokesperson Stuart C. MacDonald.
Here. Thank you, Mr. Speaker. Mr. Speaker, this is a cruel and a catastrophic policy. It will not hurt smugglers, but will further seriously harm people who have fled persecution. It will do untold damage to the international system of refugee protection and to what little remains of the UK's reputation for upholding international law. Mr. Speaker, this is worse than temporary offshoring. It is offloading of responsibility altogether. As the UNHCR has said, people fleeing persecution should not be treated like commodities. And in the words of the Refugee Council, this is nothing short of cash for deportations. 85% of refugees are in developing or the least developed countries already. Here is a wealthy UK offering cash to take some more. So much for global Britain. Mr. Speaker, the only thing that's transparent about this policy is its dodgy timing and grubby political motivation. So, in the interests of proper transparency, will she finally publish a detailed estimate of how many billions this policy will cost? She was chuntering that she had the deal all sorted out. She can now announce it to members of this House. And for what are we paying this money? Can she say what percentage of asylum seekers coming to the UK will be subjected to this abysmal treatment? Reports from Rwanda suggest capacity probably around 1%, but certainly less than 5%. Is that correct? We are told that people will be screened before transfer, but how can a pathetic screening interview possibly pick out trafficking survivors or torture victims or LGBT people? Quite simply, it can't. So is she happy to see these people subjected to this treatment? And why are women and children within the scope of this policy? And will people going through that screening process be able to access legal advice?
Oh, yeah, I doubt it.
Mr. Speaker, why aren't we allowed to see the criteria for deciding who will be sent? Where is the transparency in that? And how will she monitor their treatment? Her government has completely failed to stop abuses in UK detention centres, never mind centres that are 5,000 miles away. So, Mr. Speaker, in short, this disastrous policy has nothing to do with the global migration crisis. It has everything to do with distracting from the PM's political crises, and it is absolutely sickening for all of that.
Well, Mr. Speaker, if I may, just for the record, I actually think the Honourable Gentleman's latter comment was absolutely unacceptable. And actually, if I may, it does a great disservice, not just to members, not just to this government and officials that have worked for over 9 months on this partnership, but also to our counterparts in the world in Rwanda that have been working with us, and many of my own international counterparts as well, that are working collectively together to tackle issues of illegal migration and and if I may say so, some counterparts in the EU as well. And if I may, just to answer some very, very specific points, I think it is shameful that he is playing party political games on that point, just like the party opposite as well. No, absolutely not. If you want to let me answer the question and finish, I will. I think the other point to make, Mr. Speaker, is Rwanda. Rwanda actually is home to resettling over 130,000 refugees, and they have done that successfully. And if I may, I think your comments are a slur to the successful efforts of our partners in Rwanda. Rwanda is a safe and secure country with the respect for the rule of law. And no, absolutely not. I actually think members should just listen to the undercurrent of their tone towards the country of Rwanda, which has done a great deal to provide safety and refuge and security and a new life to many, many refugees around the world. He asked about the approach that will be taken. Everyone considered for relocation will be screened, interviewed and have access to legal advice. Decisions are made on a case-by-case basis, and nobody will be removed if it's unsafe or inappropriate for them at all. Now, I also, if I may, Mr. Speaker, I'd just like to conclude by making another point as well, because he is not the first honourable member to mention legal obligations and the legalities of this. Rwanda, like us, is beholden to the same legal obligations as the United Kingdom on human rights. And if I may, I just want to make the point again. I think there is something really, really quite unpleasant about the undercurrent of the tone that is taken to Rwanda from colleagues.
Gary Sambrook.
Sorry, Mr. Speaker, I didn't hear. In latest figures suggested, Mr. Speaker, in Birmingham, over 7,000 people in December were claiming asylum support, amounting to tens of millions of pounds. Does my right honourable friend agree with me that this plan and partnership with Rwanda will reduce the reliance on hotels and bring down small boat crossings?
Oh, I thank my honourable friend for his question, and I think actually there are a number of things. If the honourable lady wants to be less hysterical and actually listen, she might actually learn something about the new plan for immigration. I think it is important to reflect, Mr. Speaker, on a number of points. The answer to my honourable friend is absolutely yes, because we do not want people in hotel accommodation. And of course it's a cheap point for the opposition benches to make, but with the pandemic we absolutely had to use hotel accommodation as part of dispersal to actually keep people protected during the pandemic. That was a fact, and Public Health England guidance spoke to that. And of course on decision making, yes, of course, and on decision making, if you choose to listen, that's exactly what the new plan for immigration is about, in terms of speeding up asylum decision making and processing with this legislation and digitalisation of the system. And I have to add, Mr. Speaker, of course, every single member on the opposite benches have voted against this policy. They clearly want open borders. They just want to have uncontrolled migration, and they've done nothing themselves to come up with an alternative plan on this issue.
Chair of the Select Committee, Dame Diana Johnson.
Thank you, Mr. Speaker. The announcement made last week when Parliament wasn't sitting has caused a great deal of confusion around what this policy actually entails. Unfortunately, the Home Secretary turned her head away from the microphone when she was responding to the Right Honourable Lady for Maidenhead. So I wonder if the Home Secretary could answer the question about who would actually be eligible to be sent to Rwanda. Is it going to be single young men? Is it going to be women and children? And what percentage of asylum seekers does the Home Secretary think will be sent to Rwanda?
Mr. Speaker, just on the on eligibility, as I have already said, everyone considered for relocation will be screened, interviewed, have the right access to legal advice and services, and decisions will be made on a case-by-case basis. That is absolutely right and proper. But there is also the fundamental principle right now in relation to this policy and the new plan for immigration, which I'm sure she is well versed in, is that this will apply to people that are inadmissible to our asylum system and people that have come to our country illegally through illegal and dangerous routes.
Kevin Hollinray.
Mr. Speaker, the Asylum Reception Centre my right honourable friend refers to is situated in my constituency of Linton and Ouse. not a NIMBY in any shape or form, but nevertheless, this is a small rural village. It is the RAF base it's going to be situated on is right in the centre of that village. There are understandable concerns from local people that this is not the appropriate place to put such a reception centre. Would my right honourable friend meet with me to discuss the decision and see what can be done?
Absolutely. And if I may, Mr Speaker, I just want to thank my honourable friend as well, because he has been in dialogue with ministers on this issue. I'd be very, very happy to meet with him. And of course, he does understand the principle behind all of this. So I'm very happy to discuss this with him further.
Diane Abbott.
The Home Secretary asserts that Labour members do not understand the issue, but she will be aware that a former permanent secretary at the Home Office, Sir David Normington, said last week about her Rwanda policy that it's inhumane, it's morally reprehensible, it's probably unlawful, and it may well be unworkable. How does she come to know better than a former Home Office Permanent Secretary?
Mr Speaker, if I may tell the Right Honourable Lady, I'm surprised the Right Honourable Lady is using Sir David's name in vain, given it was also a former Labour Home Secretary who infamously and discourteously described the Home Office leadership and management at the time as not fit for purpose during Sir David's tenure. If I may, things have moved on in terms of the asylum in terms of the asylum system right now, which is why the new plan for immigration, which her party and members on the opposite benches continuously vote against, have no plan to deal with these important and difficult issues, and at the same time will bring in the reform that our country needs, while making sure that we preserve the efficacy of safe and legal routes for people that are fleeing persecution to come to our country and get the support that they need.
Mitchell.
Thank you, Mr Speaker. My right honourable friend deserves great personal credit for seeking to tackle this dreadful crisis which exists in the Channel. But will she accept that many of us have grave concerns that the policy she has announced simply will not work? On the subject of cost, can she confirm that she will not be using expensive military aircraft to make this 9,000-mile round trip? And on the subject of cost also, will she ensure before the House of Commons votes on this matter tomorrow that we know the cost per asylum seeker of those she is sending to Rwanda?
Well, Mr Speaker, my honourable friend, right honourable friend, who knows Rwanda as a country incredibly well, if I may say so, and we've had many discussions in the past about Rwanda. I'm very happy to meet with him and have further discussions with him as well. We will not be using military planes for any removals, but he will also, and actually many members of this House will be pretty familiar with the approach that we do take to removing failed asylum seekers and foreign national offenders, to either returning them to their country of origin or to third countries. There is a whole process around this, which is a lot of operational work and details that take place. So I'm happy to talk to him privately about that, because these are complicated ways in which we can do this. And if I may, Mr Speaker, the right honourable gentleman makes further points that I'm very happy to discuss with him as well.
Live effort.
Mr Speaker, can the Home Secretary say whether she's negotiated a cap on the cost of this arrangement with Rwanda? What will be the cost per person sent, and whether there's a limit on that cost? If so, what is it?
Mr Speaker, in terms of costs, as I've already published and said, there is an upfront £120 million development cost. And with that, of course, when we remove people, payments will be made accordingly, only once we've removed people to Rwanda.
Dame Andrew Lenz.
Thank you, Mr Speaker. I'm incredibly proud of this country and this government's track record in providing safe welcome to over 185,000 asylum seekers and refugees since 2015. And I do hope my right honourable friend will be ramping up the welcome for Ukrainian refugees. I know she'll be working flat out at it. But what I do find absolutely abhorrent and inexplicable is the way that many on the opposition benches, and in fact even in the top echelons of the Church of England and in other faiths, who have completely forgotten the images of children lying drowned on our beaches. How can they not seek to try and remedy that appalling situation? These are not refugees and asylum seekers. They are coming from France.
I thank my right honourable friend for her comments and observations. And first of all, Mr. Speaker, my right honourable friend will be very, very well aware of the work that our noble friend Lord Harrington is doing in the other place on the Ukrainian scheme right now, in terms of resettling and bringing people over for the Homes to Ukraine scheme. If I may, Mr. Speaker, the left in particular, they like to preach compassion, but there is little compassion when they do not have the backbone to actually make difficult decisions when it comes to the protection of human life. And if I may, Mr. Speaker, for months and months and months, they talk about saving lives and lost lives. And now that there is the prospect for action to save lives and to go after the evil people smugglers, they wring their hands and they choose to play party political games.
Thank you, Mr. Speaker. Members across this House are desperately concerned about the children who are often on these boats. So can we have a straight answer from the Home Secretary? Does she intend for one of the criteria to be that prevents somebody being sent to Rwanda to be being under 18? And crucially, where will the processing and the decision-making as to whether or not somebody is under 18 take place? Please, Home Secretary, be straight and honest with us what you intend to do with these children. We all deserve better.
First of all, Mr. Speaker, if I may, I've already spoken about the processing and the eligibility. Yes, I have. I absolutely have. And operational decisions are for the officials and the practitioners on the ground that undertake them. And that is part of our process that she should respect.
Peter Bone.
Mr. Speaker, I think the Shadow Home Secretary was slightly wrong when she talked about human trafficking. This isn't human trafficking, this is people smuggling. This is where evil gangs are paid money to take people across the channel. They don't care about the lives of these individuals. And the only way you're going to stop the people smuggling is if you reduce the demand for it. And the Home Secretary's Rwanda policy is absolutely right. Would you agree with me that her policy is morally the right thing to do?
My honourable friend is absolutely right. There is a distinction and a significant difference between people trafficking and smuggling. It is the smuggling gangs, the people smuggling gangs that we are trying to stop. We are trying to break up their business model and end their evil trade, and it's absolutely right that we do so. And when it comes to cases of human trafficking, it is a well-known fact, and in fact it is down to the work of my right honourable friend, the member for Maidenhead, and the work with the Modern Day Slavery Act, and the work of this government that actually has stood up the legalities and the proper processes to give those people that have been trafficked the legal protection and the safety and security that they need in our country.
Mr. Carmichael.
Thank you, Mr. Speaker. Can the Home Secretary tell the House how many people does she expect to send to Rwanda in the first 12 months of this scheme? She will be aware that Rwandan government ministers are on the record as saying that they expect their capacity to be in hundreds with a few thousand over the 5-year period. Given that 28,000 people crossed the Channel last year, does she really think that this scheme is going to have the deterrent effect she claims for it?
So his question is yes, and the scheme is uncapped, and that is exactly what we've negotiated with the Rwandan government.
David Davis.
The Home Secretary is quite properly focused on saving lives. So can I ask her a practical question? The World Bank has said that Rwanda is one of the highest incidences of malaria in the world. Our own government website warns travellers about hepatitis A and B, tetanus, typhoid, cholera and tuberculosis, not to mention rabies and dengue fever, which can't be vaccinated against. So what is the government going to do, both from an ethical and moral point of view, and to protect the British taxpayer against compensation claims, to protect the asylum seekers who go to Rwanda?
Well, my right honourable friend has made some important points, because the work that we've undertaken and the partnership with the Rwandan government is based on support directly to them, but also expertise, technical expertise in terms of resettlement, education, training, but also, as I reflected upon in my oral statement, Mr. Speaker, providing care in terms of the health and resettlement needs of those individuals.
Paula Barker.
Mr. Speaker, the proposal to treat refugees differently, purely based on how they arrived in the UK, undermines a key principle of refugee protection. Such an approach weakens the very foundation of the 1951 Refugee Convention and contradicts the steps the UK agreed to when signing up to the Global Compact on Refugees. So, what legal assurances did the government seek about protecting
I should just add, Madam Deputy Speaker, that for those that go through the asylum process, whose claim to process in the United Kingdom, issues such as absconding will have an impact on how their asylum claim is viewed and treated.
Emmy Wilson.
Deputy Speaker, I suspect that there are more asylum seekers housed in my constituency than in the constituency of many who have been hectoring the Secretary of State this afternoon. And I've heard their stories. And I know the misery which is caused by people trafficking and the desperation of those who hand over huge amounts of money and risk their lives to get into the United Kingdom. And therefore I do support the Secretary of State's aim and object to wreck this evil trade. But the question I want to ask is this: Secretary of State, if there is a lengthy processing procedure, and if at the end of that a very small percentage of those who are processed are actually left the country, do the people smugglers still not have an argument that it is worth your while handing over money to us and risking your lives?
Thank you, Madam Deputy Speaker. What I'd say in response to the honourable gentleman, there are a number of points that he's made, and he's made them incredibly well, actually, about the human misery. The human misery and the way in which people's lives are put at risk is absolutely shocking and it's tragic. We want to stop that and break that, and we have to do that upstream, Madam Deputy Speaker. It's not good enough to wait for it to come to the shores of the United Kingdom or to the coastline of France. It is simply too late, and that is why there is a whole array of work taking place, and has been, but has been redoubled now, working with intelligence and security partners upstream and with different governments as well, so that we can target those gangs, intercept those gangs, and also prosecute them, not just in our country, but actually in other countries further upstream.
Henry Smith.
Thank you, Madam Deputy Speaker. I welcome the Home Secretary's statement and a new plan for immigration. Does she agree with me that there is nothing moral at all about allowing a system that perpetuates evil people smuggling, or indeed one that puts disproportionate burden on constituencies such as my own in terms of temporarily housing migrants?
My friend is absolutely right, Madam Deputy Speaker, and I come back to the point, 2 points in particular, around the issue of criminal gangs, people smuggling. This is not a new phenomenon, it is well established, and we have to work with our international partners to absolutely break this model up and have the right level of prosecutions domestically, but also work with our counterparts on intelligence and intelligence sharing and prosecutions outside of the United Kingdom. Much of that is in the new plan for immigration, much of that is in the National Anti-Borders Bill, which this side of the House absolutely supports, that side of the House does not. And he's absolutely right in the whole principle of local authorities as well. It is unfair, Madam Deputy Speaker, that it's a handful of local authorities across the United Kingdom and England and Wales that have stood up to provide housing accommodation to meet the needs of asylum seekers. And I just think it's a shameful reflection on many of those local authorities, which will now be remedied through the dispersal policy.
Janet Davey. Madam Deputy Speaker, I cannot accept
that the Secretary of State believes that this policy is about protecting people, when we all know across this chamber that this policy is utterly harmful. The Archbishops of Canterbury and York were right for speaking out against the government plan to send in those asylum seekers and refugees to Rwanda. The government's language is one of criminalising vulnerable and traumatised people. The Bishop of York was right to say there is in law no such thing as an illegal asylum seeker. It is the people who exploit them that we need to crack down on. This policy will also cost the UK taxpayer billions of pounds, as we have seen in Australia. Isn't that correct?
Home Secretary. Well, if I may, Madam Deputy Speaker, I hear her case, but doing nothing is not an option when people are dying in the Channel.
Sir Edward Lee. Following that question, is not the, quote, ungodly thing to do is to do nothing and have a mass drowning of children in the Channel this winter? And given that there is no end of people who want to cross the Channel, however many we let in legally, isn't it morally incumbent on those who oppose this policy to explain to the House now how they are going to break the business model that once you get here, you are put in a hotel and you are never sent back?
Well, my right honourable friend is absolutely right.
Jeremy Corbyn.
Isn't the moral requirement for the Home Secretary to explain why she will deport people who've arrived in this country fleeing from desperate wars, famine and problems, and prepared to risk all to cross a dangerous sea? Don't they deserve a sense of humanity from the Home Secretary not to be deported to incarceration in Rwanda?
Well, Madam Deputy Speaker, again, I refer to the tone that the Right Honourable Gentleman is using to our partners in Rwanda, which I think, quite frankly, is quite questionable. But I would like to remind the Right Honourable Gentleman and all members of this House that France is a safe country, alongside many of the EU member states, that those that are travelling to the United Kingdom through illegal and dangerous crossings where their lives are put at risk, which is what we are trying to stop, they could and should claim asylum in those countries first of all.
David Simmons.
Thank you, Madam Deputy Speaker. I welcome much of what has been said today, but I'd like to ask my right honourable friend, given that 3/4 of child asylum seekers that come to the UK are boys aged 16 or 17, what assurance can she give me that the age assessment process will have been fully completed before they become eligible for removal from the United Kingdom?
Home Secretary.
Madam Deputy Speaker, I thank my honourable colleague for his very sensible question. And the House will be very well aware of the new age assessment work that will be put together and come forward, basically, through the Nationality and Borders Bill. This is an important piece of work which will effectively help to bring greater efficacy to the asylum system and support local authorities as well in determining the age of young people claiming asylum. Because for too long we have had some of the most egregious abuses where we've had young men masquerading as children and posing as a safeguarding threat in our schools and also in social services. So this is important work and serious work that is taking place right now, which will provide everyone the assurance around the age of those youngsters who are coming to our country and claiming asylum.
Thank you, Madam Deputy Speaker. The Home Secretary has been repeatedly asked this afternoon about the costs of this totally wrong policy. She said that she knew from examples of our existing removal schemes the costs that are involved in chartering aircraft. So can she tell us today what will be the cost of chartering one return aircraft to Rwanda? What will be the cost per one person deported? And will she admit that this will cost far in excess of the 120 million that she said was just for development costs?
Well, first of all, the honourable gentleman is absolutely wrong. And if I may, Madam Deputy Speaker, in terms of the costs of removal of individuals, I think for the record it's just worth reflecting upon the number of members on the opposite benches that frequently write to me, Madam Deputy Speaker, to stop the removal of individuals with no legal basis to be in the country when we are chartering those planes to remove failed asylum seekers and foreign national offenders. And those costs, Madam Deputy Speaker, are marginal compared to the long-term costs of housing people with no legal basis in this country, and the wider costs to society are public services, healthcare, and also housing and wider accommodation.
David Jones.
Thank you, Madam Deputy Speaker. May I commend my right honourable friend on the proposals she's announced today, which offer the real prospect of breaking the business model of the people smugglers. And is it not the case that if anyone should be coming in for criticism, whether from this side of the Thames or the other, it should be those who are plying that disgusting trade and not those who are seeking to disrupt it?
Well, my right honourable friend is absolutely right, Madam Deputy Speaker. And I think also there's a moment of reflection for all colleagues right now when it comes to those that actually thwart the removal of those with no legal basis to be in the country, and also the cost to the British taxpayer, the cost to the public purse of hard-pressed British taxpayers of not removing those individuals from this country in the first place.
Roberts.
Global Britain used to be a byword for bad trade deals. Now it's an excuse to outsource our asylum system to Rwanda. Yeah. Of course, we all stand, don't we, with the people of Ukraine in their fight to repel one dictator. But the Home Secretary is yoking the UK's reputation to another.
Hear.
Welsh and Scottish governments have long asked for talks on a solution on the establishment of safe routes for refugees. Did she engage with those two governments, or does she only talk with dictators?
If I may, Madam Deputy Speaker, I think the Right Honourable Lady will be very, very well aware of the engagement that's taken place in government around our safe and legal route for Ukrainian nationals coming over to the United Kingdom, and those discussions have taken place across the devolved administration. I should also just say, for the record, Madam Deputy Speaker, that the number of people that have come to our country through safe and legal routes stands at over 180,000 right now. Global Britain is doing more than its fair share in the world. We're leading the world when it comes to safe and legal routes. And if I may just finally conclude, Madam Deputy Speaker, when it comes to safe and legal routes, it is the Honourable Lady's party and all the party opposite, every party opposite actually, on the opposite benches, that have voted against the Nationalising Borders Bill, which actually puts into statute safe and legal routes.
Andrew Jones.
Thank you, Madam Deputy Speaker. My right honourable friend has highlighted the opening of a reception centre at the former RAF base at Linton-on-Ouse, located, of course, between Harrogate and York. Can she give us a bit more information about that? For example, when might it open, what might be its capacity, and how many local jobs will be created?
Madam Deputy Speaker, I can confirm that the centre will be opening literally in the next 6 weeks. There has been work was undertaken for several months actually on the development of the site, including capacity at the site and all the various measures that are required for the housing and accommodation of asylum seekers.
Gio Warren.
Thank you. Between 2015 and 2020, the yearly number of asylum applications stayed constant at about 30,000, but the proportion decided within 6 months, her target, plummeted from 80% to 17%, despite doubling the number of caseworkers. So isn't the truth that her asylum processing system is broken? Sending refugees to Rwanda will not fix that. And she is using those fleeing from the worst atrocities of war as a shield for her incompetence.
Deputy Speaker, the asylum system is completely broken. That is the only fact that she is correct on. I am changing the asylum system as per the Nationalising Borders Bill, which the Honourable Lady has voted against and every member opposite has voted against. This includes turning around asylum decision-making in a faster way, digitalisation of the process, but also making sure that the immigration courts and tribunals also hear more cases in faster time, which is the point that I made earlier on to a colleague in the House as well. And it's important that all these aspects of a reformed asylum system come together. She may shake her head. She shakes her head because, quite frankly, she's opposed to any reform or any controls on illegal migration and immigration.
Ms. Clarkson.
Deputy Speaker,
Ever since this policy was announced over the bank holiday weekend, we've heard some very strong rhetoric from the opposition parties, leaning into some very lazy tropes about Africa and dripping in European exceptionalism. So could I ask my right honourable friend if she'll agree with me in condemning that kind of language when talking about Rwanda? And can I admonish her to keep the course on this, because when I was talking to my constituents over the weekend, the one phrase that everybody was using is "not before time."
I thank my honourable friend for his comments. And I think, Madam Deputy Speaker, if I can refer to some of the undercurrents of the tone that has been used, not just in this House today, but more broadly around our partnership with Rwanda. Now, I could go as far to say that some of this is quite xenophobic, and quite frankly, I think it's deeply, deeply egregious. Rwanda is one of the fastest growing countries in Africa. We have an incredible partnership with them. They'll be hosts of the Commonwealth Heads of Government later on this year, and they are leading the way on the international stage on many, many international issues. And I actually think it is pretty distasteful. It says a great deal about members on the opposite benches, about their understanding of global Britain and internationalism.
George Howard.
So desperate.
Most recently, my right honourable friend, the member for Leeds Central, as have many others throughout this statement, asked for evidence that this policy could possibly work in some way or another. In each case, she declined to provide that evidence. So will she put in the library of the House of Commons all the advice she has received, internal government advice, on the legality, on the workability of the scheme, and also on the cost of the scheme? That way, at least we'll be able to assess what the evidence base is.
Well, Madam Deputy Speaker, I actually refer to the comments I made earlier on in terms of the legal basis, the legislative basis, which was all put in place under the previous Labour government. And not only that, these schemes and this proposal was also looked at under the previous Labour government as well, which, had it have been operationalised back then, Madam Deputy Speaker, we may not be having this debate today, where more people would be claiming asylum in safe countries in the EU, and the people smuggling gangs would have been broken up.
Andrew Bridgen.
Thank you, Madam Deputy Speaker. I welcome my right honourable friend's statement, and I believe the policy will work. Could my right honourable friend explain to the House what the successful implementation of her policy will look like on the ground, and in particular, what effect does she believe it will have on the numbers of vulnerable people willing to put their lives in the hands of ruthless people traffickers to gain illegal entry to our country?
Well, my friend makes important points. One is actually in the policy working and the removal of people to Rwanda, and actually overcoming many of the obstacles and hurdles, some of which honourable colleagues have touched upon this afternoon, including legal barriers and many of the barriers that we face when it comes to the removal of those with no legal basis to be in the United Kingdom. The other point to make, Madam Deputy Speaker, is quite frankly the long-term impact and effect has to be to start disrupting that business model of the people smugglers, breaking up those evil people smuggling gangs and going after them with more prosecutions, making sure the pilots of those small boats are prosecuted in the way in which I explained earlier on in my statement. That takes not just a whole-of-government approach, it also means that we have to work with our international partners across Europe and even further afield.
Alison Thewlis.
Thank you very much, Madam Deputy Speaker. My Glasgow Central constituents want none of this despicable plan. As the chair of the all-party group in immigration detention, I went to visit Napier Barracks. It is not fit for purpose. It is cold, it is bleak, it is lacking in dignity and privacy. Vulnerable people struggle to get medical, social and legal support, but at least we could visit. Madam Deputy Speaker, can the Home Secretary tell me how facilities in Rwanda will be scrutinised, particularly when Human Rights Watch says that Rwanda has arbitrary detention, ill-treatment and torture in official and unofficial detention facilities is commonplace?
Madam Deputy Speaker, I'd be delighted to tell the Honourable Lady how accommodation facilities in Rwanda and Kigali will be scrutinised. That is part of the monitoring work that the Home Office and technical officials have established, and it's part of the Memorandum of Understanding. That's if she had read the details in the MOU. The second point, Madam Deputy Speaker, is that the Honourable Lady's characterisation of Napier is grossly wrong, And on top of that, and as we have as well, and she'll be very, very aware of the facilities that have been put in place in terms of recreation, leisure facilities, legal facilities, accommodation facilities, all the things that UK British taxpayers are paying for, and the cost of that is going up and up and up.
Nick Fletcher.
Thank you, Madam Deputy Speaker. Does the Home Secretary agree with me that no one here would spend thousands of pounds to go to one country and end up in another, and that this policy will end up as a deterrent, and that will save lives and save the taxpayer money?
Well, my honourable friend actually is a voice of common sense on this, primarily because we want that deterrent effect. There's no question about that. And in addition to that deterrent effect, going after the individuals that, quite frankly, have been profiteering for decades and decades when it comes to the human misery, when it comes to people smuggling.
Thank you, Madam Deputy Speaker. Given that we know many Rwandans seek and are granted asylum here in the UK, how can the Home Secretary possibly tell the House with a straight face that Rwanda is a safe country to send people seeking asylum?
Home Secretary.
Well, I'm going to refer the honourable gentleman to the comments that I've made earlier about Rwanda. Rwanda is a safe country. I think the tone that he has applied to Rwanda as a country and our partnership is unjustifiably insulting. I'm going to leave my remarks there, Madam Deputy Speaker.
Craig McKinley.
Speaker, it would seem to me there are some who actively celebrate the porosity of the French border. That weakness has seen 28,000 irregular crossings, a huge number of deaths, appalling deaths, and a trade that is bigger than the drugs trade. Contrast that with my right honourable friend's new policy, which will actually normalise proper immigration rules, taking people to safe countries for proper processing in the right way. Can she understand my confusion that people are not celebrating this new policy?
Well, I thank my honourable friend for his support and his comments. I think, Madam Deputy Speaker, as I said earlier on, I do think the party opposite should just be honest about their position. They clearly stand for open borders. They do not believe in controlled immigration. We have a points-based immigration system which provides legal routes for people to come to the United Kingdom. They do not want the differentiation between legal and illegal routes. But I tell you who does, Madam Deputy Speaker, that's the British people.
Rachel Maskell.
Thank you, Madam Deputy Speaker. When somebody is trafficked or smuggled into the UK and then determines that they don't want to be deported to Rwanda, what steps will she take to uphold their rights under the Refugee Convention?
Madam Deputy Speaker, as I said earlier on in my remarks, first and foremost, there is a difference between trafficking cases and those that have been smuggled through the people smuggling routes. When it comes to cases that are trafficking, we have all the legal basis to provide support and also to go after the traffickers in terms of the abuses that they have committed, and she'll be very familiar with all of that. But not only that, Madam Deputy Speaker, I say it again, every case is determined case by case, and with that, of course, that means the right kind of legal support, both in this country and also in Rwanda.
David Morris.
Thank you, Madam Deputy Speaker. Madam Deputy Speaker, people smuggling doesn't start at Calais. It can go through 5 different countries before it actually gets to Calais. Then we have the abhorrence of people drowning in the Channel. I understand the House's concerns over sending people to Rwanda. However, we have one champion in here, which sadly is not in his place at this moment in time. When he was the Shadow Secretary for DFID and became the Secretary for DFID, the Honourable Member for Sutton Coldfield did have a lot to do with Rwanda, and he's got the utmost respect from their government. Would my right honourable friend utilise his talents and use him in some ambassadorial way to make sure that it would allay the fears of the members of this House?
If I may, Madam Deputy Speaker, my honourable friend makes actually some very, very important points, particularly about the country of Rwanda, and those of us in this House that know Rwanda well, and I put that in the context of some of the ignorance that has been utilised and spoken about today, and actually about the incredible work of the Rwandan government through very difficult times, but more recently, how they have become almost Africa's voice on the international stage.
Ms Matheson.
Can I challenge this lazy and probably sexist assumption that all young men are economic migrants? Does she not understand that in conflict situations, especially civil wars, whether it's Afghanistan, Syria, Libya, Ethiopia, Sudan, one side will come to a town or a village and either press gang all the young men to fight for them or kill them, and then the other side will come in and do exactly the same. And what these young men are doing is not economic migrancy, but trying to flee from a war they want nothing to do with.
Well, Madam Deputy Speaker, of course, that is exactly why we are proposing safe and legal routes, as we've done with Syria, Afghanistan. These are bespoke routes that actually help those that are fleeing persecution. And there's an important point that he has made in there, which also means why our case-by-case approach on assessment when it comes to those seeking asylum is absolutely applied in the right kind of way. And the new plan for immigration and the National Anti-Borders Bill is trying to do exactly that by bringing efficacy to our asylum system to make sure that we can help those in genuine need.
Jerome Mayhew.
The EU uses Rwanda for refugee settlement. The United Nations uses Rwanda for refugee settlement. Even the Labour government legislated to use safe third countries to process asylum claims. Given this, does my right honourable friend agree that exactly the same approach lies behind this partnership with Rwanda?
Is absolutely right, and it goes without saying that, of course, it seems to be fine, depending on your political persuasion, to say it's fine for the EU, it's fine for the UN, but it's not fine for the British government. That is simply not acceptable. This has worked in the past, and I come back, Madam Deputy Speaker, to the fundamental principle that doing nothing is not an option. While people are drowning, not just in the Channel, but also in the Mediterranean, people are taking dangerous journeys, often through Libya, making difficult and dangerous crossings across the Mediterranean and then across the Channel. That is what we want to stop, and we have a moral duty to do everything we possibly can to break up that model.
Indeed, Madam Deputy Speaker. Well, we know that 2/3 of migrants arriving by dangerous routes have a legitimate claim for asylum. But in respect of the remainder, can the Home Secretary please tell us what new agreement she has struck with the top 5 countries of origin of economic migrants in respect of returning migrants, improving visa application processes and tackling people smuggling at source?
Well, of course, Madam Deputy Speaker, so tackling people smugglers at source is exactly what our country and government are leading on right now. And we're leading on that work with our intelligence and security partners, and also through law enforcement cooperation as well. And we're doing this through our EU near neighbours, so France, Belgium, the Netherlands, but also countries further upstream, including Italy and Greece. And it's right that we do that. And this is difficult work, and we are supporting them. My final comment, Madam Deputy Speaker, very much comes back to a question from the Honourable Lady, but also points made by others. In terms of speeding up processes, this is exactly what the National Anti-Borders Bill is about. It's making sure that we can speed up asylum claims, stop the merry-go-round of going to the courts and tribunal again and again and again, and ensure that we can bring efficacy to the asylum system.
Jack Brereton.
Thank you, Madam Deputy Speaker. I very much welcome measures that will offer proper deterrence to those who are seeking to come to this country illegally. I also particularly welcome action to ensure that people are dispersed more fairly right across the country. Does my right honourable friend agree that for far too long, areas like Stoke-on-Trent have taken far more than our fair share, and it's about time other parts of the country did their part?
Well, my honourable friend is absolutely right, and I do just want to pay tribute to Stoke Council and to all parliamentary colleagues from Stoke-on-Trent. You've made the representation over a long period of time, many times, and with great strength and great feeling. The dispersal policy is important, Madam Deputy Speaker. I've touched on it already, but it is a complete and utter shame. I appreciate, the nationalists, have been howling about this policy, while at the same time only one local authority has actually supported the dispersal policy. In the principle of fairness and a sense of fairness across the country and to British taxpayers, we must make sure that every local authority participates in this scheme.
Paul Blomfield.
Thank you, Madam Deputy Speaker. And can I try
to get a clear answer to the question that others have asked. The Home Office fact sheet on this proposal explains, quote, every person who comes to the UK illegally or by dangerous and unnecessary methods will be considered for relocation to Rwanda. And the Home Secretary seemed to confirm that in her earlier comments. So will she confirm now that women and children who come to the UK through irregular routes, fleeing conflict and repression, will be eligible for transfer to Rwanda, and not just the adult men, as her department briefed the media?
Well, Madam Deputy Speaker, I'll repeat what I said earlier on, that decisions will be taken on a case-by-case basis, and nobody will be removed if it's unsafe or inappropriate for them.
Jonathan Gullett.
Thank you, Madam Deputy Speaker. May I warmly congratulate my right honourable friend, the Home Secretary, for this fantastic policy which people overwhelmingly supported when they voted for Brexit in 2016, and they overwhelmingly voted for the Conservative Party in Stoke-on-Trent for the first time across the board. Does she agree with me that it's about time that other local authorities did their bit, particularly in Scotland, and that the North Islington Wokarati are more than welcome to come to Stoke-on-Trent and explain why they oppose it? Perhaps they should send a member for Bury South to explain why.
Madam Deputy Speaker, I think it's fair to say that my honourable friend has made a very, very powerful and compelling case for the dispersal policy. But equally, as to why doing nothing is no longer an issue when it comes to reform of the asylum system, but also dealing with how we remove those individuals with no legal basis to be in the UK, particularly those that have travelled to the United Kingdom illegally through dangerous crossings who come from safe European countries.
Lawrence Ashlomi.
Madam Deputy Speaker, I agree with the Right Honourable Member in that our asylum seeker is broken, and that £5 million cost is a cost too much, including the people that are staying in hotels in my constituency on South Lambeth Road, the many people I'm trying to help in terms of their asylum claim. So many people in Vauxhall have contacted me, they're worried about this policy. The FCO website states that Rwanda is not a safe place and it's frowned upon for people of LGBT. There are many LGBT people who claim asylum. Can the Home Secretary guarantee that those people will still be safe and not sent to a country where they could be at harm?
Absolutely we can, and that was part of our negotiation with the Rwandan government and has been very clear in the legal agreement that we have between us.
Butler.
Thank you very much, Madam Deputy Speaker. Does my right honourable friend agree that the crucial point here is that the partnership with Rwanda is for people attempting to come to the UK illegally? And has she been struck, as I have, that despite the complaints, despite the carping, despite sometimes the caterwauling from the benches opposite, when it comes to proposing an alternative, a thought-through, a responsible plan, what is deafening is their silence?
My friend is absolutely right, and Madam Deputy Speaker, I'll repeat what I said earlier on. It's the same party opposite that write letters to me frequently to stop us from removing people with no legal basis to be in the UK, including many foreign national offenders, rapists, murderers, paedophiles, you name it, along with asylum seekers. And that speaks volumes, it really, really does, when it comes to protecting our country and protecting British citizens.
Manira Wilson.
Thank you very much, Madam Deputy Speaker. Like me, the Home Secretary is the daughter of East African Indian immigrants whose family sought sanctuary and a better life in this country. So does she not feel, as I do, a personal moral responsibility to extend the generosity that was shown by the British government to our communities in the 60s and 70s by providing further safe and legal routes to the UK for refugees rather than shipping them off to Rwanda?
Deputy Speaker, Mr. Speaker, when it comes to safe and legal routes, I hope the Honourable Lady will vote with the government when it comes to the Nationality and Borders Bill, because that's exactly what this government is proposing. And as I've already said, 180,000 people have been brought to the United Kingdom under safe and legal routes, and this government is committed to doing much, much more.
That concludes this statement. I'm sorry for those who didn't get in. I'm sure we've got a list of names in order that we may look to them. We now come to the next statement. I now call the Prime Minister to make his statement. Prime Minister.
Thank you, Mr. Speaker. With permission, I'll update the House on the Government's response to events at home and abroad during the Easter recess. I will come to Ukraine in a moment, since I've just left a virtual meeting with President Biden, President Macron, Chancellor Scholz, and 8 other world leaders. But let me begin in all humility by saying that on the 12th of April, I received a fixed penalty notice relating to an event in Downing Street on the 19th of June 2020. I paid the fine immediately, and I offered the British people a full apology. And I take this opportunity on the first available sitting day to repeat my wholehearted apology to the House. As soon as I received the notice, I acknowledged the hurt and the anger. And I said that people had a right to expect better of their Prime Minister. And I repeat that, Mr. Speaker, again in the House now. Let me also say, not by way of mitigation or excuse, but purely because it explains my previous words in this House, that it did not occur to me then or subsequently that a gathering in the Cabinet room just before a vital meeting on COVID strategy could amount to a breach of the rules. I repeat, that was my mistake, and I apologise for it unreservedly. I respect the outcome of the police investigation, which is still underway, and I can only say that I will respect their decision-making and always take the appropriate steps. And as the House will know, I have already taken significant steps to change the way things work in Number 10. And it is precisely because I know that so many people are angry and disappointed that I feel an even greater sense of obligation to deliver on the priorities of the British people and to respond in the best traditions of our country to Putin's barbaric onslaught against Ukraine. Our Ukrainian friends are fighting for the life of their nation, and they achieved the greatest feat of arms of the 21st century by repelling the Russian assault on Kiev. And the whole House will share my admiration for their heroism and courage. Putin arrogantly assumed that he would capture Kiev in a matter of days. And now the blackened carcasses of his tanks and heavy armour litter the approaches to the capital on both banks of the Dnieper and are smouldering monuments to his failure. Having pulverised the invaders' armoured spearheads, the Ukrainians then counterattacked, and by the 6th of April, Putin had been compelled to withdraw his forces from the entire Kiev region. Britain and our allies supplied some of the weaponry, but it was Ukrainian valour and sacrifice which saved their capital. I travelled to Kiev myself on the 9th of April, the first G7 leader to visit since the invasion, and I spent 4 hours with President Volodymyr Zelensky, the indomitable leader of a nation fighting for survival who gives the roar of a lion-hearted people. I assured him of the implacable resolve of the United Kingdom, shared across this House, to join with our allies and give his brave people the weapons they need to defend themselves. When the President and I went for an impromptu walk through central Kiev, we happened upon a man who immediately expressed his love for Britain and the British people. And he was generous enough to say, quite unprompted, I should reassure the House, I will tell my children and grandchildren they must always remember that Britain helped us. But the urgency is even greater now because Putin has regrouped his forces and launched a new offensive in the Donbass. We knew this danger would come. And when I welcomed President Duda of Poland to Downing Street on the 7th of April and Chancellor Scholz the following day, we discussed exactly how we could provide the arms that Ukraine would desperately need to counter Putin's next onslaught. On the 12th of April, I spoke to President Biden to brief him on my visit to Kiev and how we will intensify our support for for President Zelensky, and I propose that our long-term goal must be to strengthen and fortify Ukraine to the point where Russia will never dare to invade again. Just as our foreign policy must look to the long term, the same is true of this government's domestic priorities. And as we face the economic aftershocks of COVID and the consequences of Russian aggression, that is above all in tackling the impact on British energy prices and on consumers and on family bills. And that's why we're spending over £9 billion to help families struggling with their bills. We're helping families to insulate their homes and reduce costs, and to end our dependence on Putin's oil and gas, and to ensure that energy is cheaper in the long term. We published on the 7th of April a new strategy to make British energy greener, more affordable and more secure. We will massively expand offshore wind, and in the country that split the atom, we will build a new reactor not every decade, but every year. This government is joining with our allies to face down Putin's aggression abroad while addressing the toughest problems at home, helping millions of families with the cost of living, making our streets safer and funding the NHS to clear the COVID backlog. My job is to work every day to make the British people safer, more secure and more prosperous, and that is what I will continue to do, and I commend this statement to the House.
We now come to the Leader of the Opposition, Keir Starmer.
What a joke. Even now, as the latest mealy-mouthed apology stumbles out of one side of his mouth, a new set of deflections and distortions pour from the other. But the damage is already done. The public have made up their mind. They don't believe a word the Prime Minister says. They know what he is. As ever with this Prime Minister, those close to him find themselves ruined, and the institutions he vows to protect damaged. Good ministers forced to walk away from public service, the Chancellor's career up in flames, and the leader of the Scottish Conservatives rendered pathetic. For all those unfamiliar with this Prime Minister's career, this isn't some fixable glitch in the system. It's the whole point. It's what he does. It's who he is. He knows he's dishonest and incapable of changing, so he drags everybody else down with him. The more people debase themselves, parroting his...
Order! I can't hear what's being said because you're making trouble. Mr Babrickan, I'm all right. Keir Starmer. What I would say is, I think the leader said dishonest. I don't think that's an appropriate word to be. I think I will make. We don't want to talk about breaking rules, do we? I don't think that's a good time to discuss. I just say, I think if he just withdraws that and works around, I'm sure that with the knowledge that he's gained over many, many years, he can use appropriate words that is in keeping with good temperate language of this House. Keir Starmer.
Mr Speaker, I respect that ruling from the Chair. The Prime Minister knows what he is. And so he drags everyone else down with him. The more people debase themselves, parroting his absurd defences, the more the public will believe all politicians are the same, all as bad as each other, and that suits this Prime Minister just fine. Some members opposite seem oblivious to the Prime Minister's game. Some know what he's up to, but are too weak to act. But others are gleefully playing the part the Prime Minister cast for them. A minister on the radio this morning saying it's the same as a speeding ticket. No, it's not. No one has ever broken down in tears because they couldn't drive faster than 20 miles an hour outside a school. Don't insult the public with this nonsense. But, Mr. Speaker, as it happens, the last minister who got a speeding ticket and then lied about it ended up in prison, and I know because I prosecuted him. And last week, we were treated to a grotesque spectacle. One of the Prime Minister's loyal supporters accusing teachers and nurses of drinking in the staff room during lockdown. Members opposite can associate themselves with that if they want. But those of us who take pride in our NHS workers, our teachers, and every other key worker who got us through those dark days will never forget their contempt. Plenty didn't agree with every rule the Prime Minister wrote, but they followed them nonetheless. Because in this country, we respect others. We put the greater good above narrow self-interest, and we understand that the rules apply to all of us. This morning, I spoke to John Robinson, a constituent of the member for Lichfield. I want to tell you his story. When his wife died of COVID, John and his family obeyed the Prime Minister's rules. He didn't see her in hospital. He didn't hold her hand as she died. Their daughters and grandchildren drove 100 miles up the motorway, clutching a letter from the funeral director in case they were questioned by the police. They didn't have a service in the church. John's son-in-law stayed away because he would have been the forbidden seventh mourner. Doesn't the Prime Minister realise that John would have given the world to hold his dying wife's hand, even if it was just for 9 minutes? But he didn't, because he followed the Prime Minister's rules. Rules that we now know the Prime Minister blithely, repeatedly and deliberately ignored. After months of insulting excuses, today's half-hearted apology will never be enough for John Robinson. If the Prime Minister had any respect for John and the millions like him who sacrificed everything to follow the rules, he'd resign. But he won't, because he doesn't respect John. He doesn't respect the sacrifice of the British public. He is a man without shame. Looking past the member for Lichfield and the nodding dogs in the Cabinet, there are many decent, honourable members on the benches opposite who do respect John Robinson, who do respect the British public. They know the damage the Prime Minister is doing. They know things can't go on as they are. And they know it's their responsibility to bring an end to this shameful chapter. Today I urge them once again, don't follow in the slipstream of an out-of-touch, out-of-control Prime Minister. Put their conscience first. Put their country first. Put John Robinson first. And remove the Prime Minister from office. Bring decency, honesty and integrity back into our politics. And stop the denigration of everything that this country stands for. Thank you.
Sir William, Prime Minister.
Mr. Speaker, I apologise once again profusely to John Robinson, to all those who lost loved ones, particularly those who suffered during the pandemic. And Mr. Speaker, in my statement I have tried to explain why I spoke to the House as I did. The Right Honourable Gentleman has chosen to respond with a series of personal attacks on me, and I understand why he does that. But I think and I understand that, Mr. Speaker, but I think it would have been a good thing if, in the course of his remarks, he had addressed some of the issues that I mentioned, not least the crisis in Ukraine, with the impact that that is having on the livelihoods of everybody in this country. And it is to address that that this government will get on with our job, Mr. Speaker. It is to focus on the needs of the British people. And when he talks about nodding dogs, Mr. Speaker, I'd remind the House that there was a certain nodding dog who sat nodding in the previous Labour shadow cabinet, Mr. Speaker, that would happily have installed the honourable member for Islington North and made, I think, a disastrous mistake in the security of our country at a very difficult time. This government will get on with the difficult job of taking us through the aftershocks of the COVID pandemic, leading not just this country, but I think the world in our response to the violence that we're seeing in Ukraine. I must say that I renew my apologies. I renew my apologies to John Robertson, to families up and down the land. But I think the best thing that we can do now for this country as politicians is not to indulge in personal abuse of the kind that we've heard and to get on with our jobs.
Sir William Cash.
Thank you, Mr. Speaker. Having heard the remarks both of my right honourable friend and the Leader of the Opposition, may I put it to the House that my right honourable friend, I'm sure, appreciates that it is crystal clear that a fixed penalty notice, such as in his own case, is a civil penalty fine, which, if paid within 28 days, eliminates future prosecution in the criminal courts, and furthermore, without any admission of guilt. In a recent criminal case, in a recent criminal appeal case, and in that judgment, it was said that if the payment was made within those 28 days, a fixed penalty notice was held not to be a conviction, as the defendant, to quote the court's judgment, quote, was not admitting an offence or criminality and would have no stain imputed to his character. That is the perspective, and that is the case.
Prime Minister.
Mr. Speaker, I want to make it absolutely clear that I in no way minimise the importance of this fine. I am heartily sorry for my mistake, and I accept completely the decision of the police.
Leader of the SNP, Ian Blackford.
Thank you, Mr. Speaker. Let us remind ourselves that on the 8th of December last year, the Prime Minister denied that any parties happened in 10 Downing Street. They are the very same parties that the police have now fined the Prime Minister for attending. By now, people know that the rules of this House prevent me from saying that the Prime Minister deliberately and willfully misled this House. But maybe today that matters little, because the public have already made up their minds. Yep. YouGov polling shows 75% of the British public and 82% of people in Scotland have made their minds up on the Prime Minister. The public knows the difference between the truth and lying.
Hear, hear.
And they know that the Prime Minister is only apologising for one reason, and one reason only. It's the only reason he ever apologises, because he's been caught. Yep. After months of denials, his excuses have finally run out of road, and so must his time in office. The Prime Minister has broken the very laws he wrote. To try and argue that he did not know he had broken his own laws would be laughable if it wasn't so serious. Yep. Prime Minister, you can't hide behind advisers. He knows, we know, that the dogs in the street know that the Prime Minister has broken the law. Yep. This is the first Prime Minister to be officially found to have broken the law in office. A law-breaking Prime Minister. Just dwell on this. A Prime Minister who has broken the law and remains under investigation over additional law-breaking. not just a lawbreaker, a serial offender. If he has any decency, any dignity, he would not just apologise, he would resign. Yes. Mr. Speaker, the scale and the seriousness of the issues we are all now facing demand effective leadership from a Prime Minister who can be trusted. The Tory cost of living crisis and the war crimes being inflicted on the Ukrainian people need our full focus. In a time of crisis, the very least the public deserves is a Prime Minister they can trust to tell the truth. And for this Prime Minister, that trust is broken and it can never be fixed. The truth is that a majority of people across these islands will never trust a single word he says again. So the questions today are not so much for a Prime Minister desperately clinging on to power. The real question is for Tory backbenchers. Will they finally grow a spine and remove this person from office? Or is the Tory strategy to go on about standing behind a Prime Minister who the public can't trust with the truth?
Mr. Speaker, I direct the right honourable gentleman what I said earlier. I apologise profusely for my mistake and for what I have got wrong, and I repeat that. He asks about whether this government is capable of providing effective leadership during the current crisis and in standing up to Russia. And I would just remind him that I think it is still the policy of the Scottish National Party to dispense with this country's independent nuclear deterrent at a particularly crucial time. I don't think that's what this country needs right now.
John Whittingdale.
Many of my constituents are angry about breaches which happened 2 years ago, and I welcome the Prime Minister's recognition of that and his apology. But does he agree that we currently face the gravest crisis in our global security for a long time, and it is essential that we remain focused on beating Putin and stopping the aggression against Ukraine? Can he say what additional measures we can now give to Ukraine following his discussion with President Biden and others to ensure that Putin's aggression cannot be allowed to succeed?
I thank my right honourable friend, and I repeat my apologies, my contrition. But I want to say on the state of the war in Ukraine, it's at a very perilous stage, and it is vital now that we don't allow Putin to gain momentum in the Donbass as he well could, and in the east, and that's why we are stepping up our supply of military hardware, the kind that I think the Ukrainians particularly need now. This will become an artillery conflict. They need support with more artillery. That is what we will be giving them, Mr. Speaker, in addition to many other forms of support.
Dame Margaret Hodge.
Thank you, Mr. Speaker. I see that the Prime Minister is anxious to move on to other issues, and I think the question is, can he do that? And I would take one example. Can he perhaps explain to me, to the House and to the country, how he can credibly justify, on the one hand, calling for the resignation of the boss of P&O Ferries when he faced allegations that he broke the law, while on the other hand, refusing to resign when he himself is guilty of actually breaking the law he set.
I thank her very much, and I think that what the P&O Ferries did was entirely wrong, as I've told the House before. And I think, by the way, that I made a serious mistake, and I apologise for it very sincerely.
Mark Harper, I lost him.
Speaker, I strongly support the government's actions in standing up to Putin's aggression and helping Ukraine defend itself and our values. And it's exactly at times like this that our country needs a Prime Minister who exemplifies those values. I regret to say that we have a Prime Minister who broke the laws that he told the country they had to follow, hasn't been straightforward about it, and is now going to ask the decent men and women on these benches to defend what I think is indefensible. I'm very sorry to have to say this, but I no longer think he is worthy of the great office that he holds.
Well, I must say to my right honourable friend. I know the care and the sincerity with which he weighs his words, and I bitterly regret what has happened. I bitterly regret the event in Downing Street, as I have said. But I do believe that it is the job of this government to get on with the priorities of the British people, and that is what we're going to do.
Ed Davies.
Speaker, a poll over the weekend asked 2,000 people what they think of the Prime Minister. The most common word they used, by far, was liar. Yep. Does the Prime Minister understand how profoundly damaging it is to our great country to have a government led by a man the public no longer trust and no longer have confidence in? Mr. Speaker, if the Prime Minister won't resign, will he at least give Conservative MPs on Thursday a free vote? So Conservative MPs can decide for themselves whether the Prime Minister deliberately misled Parliament or was just so incompetent that he didn't even understand his own laws.
Mr. Speaker, I repeat what I've said earlier. I disagree profoundly with what he's just said, but I repeat my apology to the House and to the country.
Jake Barrett.
Thank you, Mr. Speaker. The people of Rossendale and Darwin will have weighed the words of the Prime Minister carefully, listening to them today, and they will, like me, feel that it is a contrite and wholehearted apology. They will also be looking at the action of the Prime Minister in Ukraine, and I wonder if he would consider putting Britain at the forefront of a new Marshall Plan to rebuild Ukraine after Putin has been defeated, and fund this in part by the assets confiscated by the British state from Russian oligarchs.
Can I thank my right honourable friend for his excellent suggestion? It's one, indeed, that the UK government is already pursuing, and in my conversations with President Zelensky, we did discuss exactly how the supporters and friends of Ukraine around the world can help to rebuild that beautiful country when the conflict is over.
Coulter.
Mr. Speaker, we've always known, haven't we, that he was only ever sorry because he was caught banged to rights. And this latest spin about the Met having it wrong is designed to bully the Met and to provide cover to his backbenchers that haven't got the bottle to sack him. But the country has already concluded that he's either a liar or an idiot.
Sorry. I said we want temperate language. When we have the motion on Thursday, that is a different matter. For today, we're not using language like that.
Well, I withdraw the word liar, Mr. Speaker, but the electorate will have already decided. But what everybody knows is that he is a lawbreaker. Yeah. So if the Met have got the wrong end of the stick, why doesn't he challenge these penalties before the criminal court? Have his day in court.
I thank the honourable gentleman very much, and I just want to repeat what I said in my statement earlier, which is that I fully respect the decision of the police.
Dr. Julian Lewis.
Does my right honourable friend have the power to authorise Sue Gray to publish her report in full? And if so, will he use that power in order to put an end to this matter so that we do not get diverted away, as we are being, from such crucial question as supplying armaments to Ukrainian Democrats?
I thank my right honourable friend very much, but I think it very important that the Met should conclude their investigation before the Sue Gray's final report.
Today marks the Prime Minister's 1000th day in office. It takes a particular type of Prime Minister to rack up as many catastrophic failures, scandals as U-turns as days on the job. From the Tory-made cost of living crisis, dodgy COVID contracts for his cronies, unlawfully proroguing Parliament, and now breaking the law. Enough is enough. So will the Prime Minister confirm if this 1000th day will be his last? 1000th day will be his last.
Leading the world in standing up to Putin, Mr. Speaker.
I can't hear you, sir.
Thank you, Mr. Speaker. I appreciate the Prime Minister coming here today and taking full responsibility and apologising. But it is very clear, Mr. Speaker, repeatedly, President Zelensky has identified the Prime Minister as Ukraine's greatest ally. He's also been identified, I think, by President Putin as enemy number one. Does the Prime Minister agree that this isn't a bad accolade to have? And doesn't he also agree that months of psychodrama in here would play into the hands of the latter, not the former?
I think it's very important, Mr. Speaker, that the people in this country should understand. Although the country is faced with massive issues that we have to deal with, the aftershocks of COVID and the war in Ukraine, I in no way minimise the importance of the fine I have received, and I apologise wholeheartedly.
Mick Whitley.
Thank you very much, Mr. Speaker. I think people across the House would agree that the situation in Ukraine is a very serious one, and there's no doubt we fully support what's going on and what we're trying to do. But setting that aside for a minute, the Prime Minister stands before us today as the first resident of number 10 to be found guilty of breaking the law while serving in public office. And while he's finally apologised today, it's been accompanied by the absurd caveat that the man who set the rules couldn't understand them. Will the Prime Minister concede that him remaining in office would deal a grievous blow to the rule of law in this country? And for the first time in his career, will he put the national interest before his personal ambition and resign?
Thank you very much. I repeat my apology. I direct him to what I've said earlier on, and I think what the people of this country need is us focusing on their issues and their priorities, and that's what the government is going to do.
Holly Membercroft.
Can I thank the Prime Minister for the update he's given this afternoon on the energy security strategy, and particularly for the support that this offers for steel. It is the latest in a long line of support that the Prime Minister has brought forward. It also sets out plans on wind, solar and nuclear. Does he agree with me that the best possible place to make the steel needed for these projects is right here in the UK?
Yes, and she is completely right, and that's why our energy security strategy is so absolutely vital, not just for consumers, but also for British industry.
Richard Bergen.
Thank you, Mr. Speaker. A new poll shows 3/4 of the public think the Prime Minister deliberately lied about breaking lockdown rules. Yet on Thursday, the Prime Minister will order his MPs to stop his law-breaking ever coming before the Privileges Committee. If the Prime Minister has nothing to hide, why doesn't he do the straightforward thing and refer himself to the Privileges Committee? What's the Prime Minister scared of?
Mr. Speaker, the House will decide.
It's not bad. Peter Bone.
Thank you, Mr. Speaker. May I thank the Prime Minister for coming to the House at the earliest opportunity to update us on this situation. On Thursday, sir, following your announcements this morning, this House has got to decide whether to refer the Prime Minister to the Privileges Committee. There is only one issue. Did the Prime Minister deliberately mislead the House? Could I ask the Prime Minister, did you deliberately mislead the House at the dispatch box?
No, Mr. Speaker.
Sammy Wilson.
Prime Minister, there will be millions of angry people across the United Kingdom today, even after the apology which has been given here today, who will still remain angry because of what they've gone through. But I think that any objective listener today will recognise that for whatever reason, the apology given today was a genuine apology, and that we now need. And I would also remind the Prime Minister there are hundreds of thousands of unionists in Northern Ireland who are angry about other things as well that happen. But rather than focus on the past, I think it is important we focus on the future. And the Prime Minister has said that he discussed today the situation in Ukraine with world leaders. That situation is becoming very desperate. What discussions has he had about giving the appropriate weaponry to the Ukrainian forces so that they can drive back the Russians, liberate their country, and avoid all of the consequences, whether it's in terms of our economy, oil, or food for the rest of the world?
I thank him very much, and as he knows, the UK is in continuous discussion with the Ukrainians about what we can do to help them defend themselves, and a lot has gone, and a lot more will be going. While I'm at it, I want to pay tribute to a particular Northern Ireland business, used to be Short Brothers, now Thales, that has been absolutely indispensable, as he knows, in helping the Ukrainians against Russian armour.
John Barron. Mr. Speaker, the government and British people have provided extensive support to Ukrainian refugees, but there remain in Afghanistan around 200 British Council contractors, many of whom are fleeing from the Taliban. I'm awaiting a meeting with the refugee minister, one that was promised back in November. Will he use his good offices to speed that meeting along?
I thank him very much, and yes, of course, and those 200 contractors for the British Council should, I believe, automatically be eligible, and certainly should be able to come under the scheme that we put in place. But I'll make sure he gets the meeting he wants.
Yeah. Chris Brown.
Thank you, Mr. Speaker. As chair of the all-party group on Russia, I found it very difficult this Easter to have any faith, seeing the barbarity meted out to the people of Ukraine. Women tortured, raped, their children tortured and raped, their menfolk, in many cases, their hands tied and then shot in the back of the head. All of these we know to be war crimes. But many of these worst atrocities are being committed by sociopaths working as mercenaries, paid for by the Russian government, by the Russian state, but nonetheless working as mercenaries. The UK still isn't a signatory to the Convention on Mercenaries. Isn't it time we put a stop to this terrible barbarity, not just in Ukraine, but in other places in the world where mercenaries from the Wagner Group operate with sociopathic intent?
I thank him very much, and I thank the right honourable. I will study his proposal on mercenaries, and I say to him that I think he's been right for a long time on Russia, and he's been vindicated.
Sir Geoffrey Clifton-Brown.
Thank you, Mr. Speaker. I've heard the fulsome apology by the Prime Minister, but what he is doing is taking a lead in Ukraine, and what he needs to do, if I may suggest, is keep giving Ukraine defensive weapons so that we can eventually drag President Putin and the Russian Federation to a peace agreement, and then would he lead the world in gaining reparations so that that great country can be rebuilt again.
I thank him very much, and I thank him for his staunch position on Ukraine. He's completely right. I'm afraid that there is now no easy way of finding a diplomatic or a negotiated solution. I know the House would have preferred that, but I think it's going to be very difficult, as it were, to construct an off-ramp for Vladimir Putin. And we are now in a logic where we must simply do everything we can collectively to ensure that Vladimir Putin fails, and fails comprehensively, in Ukraine.
Mohammed Yassin.
Thank you very much, Mr. Speaker. The majority of my constituents are sickened and furious that the Prime Minister broke the laws that they followed, putting their lives on hold, missing out on big life events, and even losing the chance to say goodbye to loved ones to protect the NHS and save lives. Does the Prime Minister agree with my constituents, Robert, who believes that lawbreakers should not be lawmakers?
Mr. Speaker, I apologise profusely particularly to all those who lost loved ones, and I know painful it has been. But I repeat what I've said. I believe that the job of the government now is to get on with delivering on the priorities of the country at a difficult time.
Brendan Clark-Smith.
Thank you, Mr. Speaker. And I know the Prime Minister has offered his wholehearted apology for the fixed penalty notice he received, which I very much welcome. But can I encourage the Prime Minister not to take any lectures from the Labour Party opposite, bearing in mind the number of FPNs their previous cabinet received? And yes, speed does kill. Yes. Or, of course, on this occasion, the FPNs that the Labour Party and SNP did not receive. Does the Prime Minister agree with me that everybody should be equal under the law?
Well, yeah, of course I agree with that, Mr. Speaker. But the issue here today, let's be frank, is what I did and what I got wrong, and I renew my apologies.
Dame Angela Riedel.
Thank you very much, Mr. Speaker. The Prime Minister accepted the Health Secretary's resignation for breaking guidance, COVID guidance, not COVID laws. The Prime Minister then accepted Allegra Stratton's resignation for joking that the parties that were so frequent in Downing Street were actually a business event. He's now using her joke as his defence. Why is he holding himself to lower standards than he held the people whose resignations he accepted to?
Mr. Speaker, all I can say is that I apologise for what I got wrong, and I've explained to the House why I spoke in the House as I did. And what I want to do is to get on with the job of the government in taking this country forward, and that is what we're going to do.
Baker. Thank you, Mr. Speaker. I dare say that every member of this House can bring to mind their own John Robinson, perhaps several. And though you would not know it, I also think that most members of this House know that justice and mercy and humility also go hand in hand, a fact known by many who watch these proceedings too. In asking us to forgive him on behalf of all of those John Robinsons we represent, my right honourable friend could not have made a more humble apology. But what I want to say to him is that justice leading into mercy relies on a very, very old-fashioned concept, and that is repentance. What assurance can he give us that nothing of this kind will ever happen again?
I thank him for what he has said, and I am heartily sorry, as I have said, and I wish it had not happened, and I wish that things had been totally different. What I have already done, as the House will know, is taken steps to change the way we do things in number 10. But that in itself is not enough. I accept full responsibility myself for my actions.
Absolutely.
Thank you, Mr. Speaker. The Prime Minister's supposed apology to the nation is pathetic. He told bereaved families in Downing Street last year that he had done everything possible to save their loved ones. Now he's been fined for breaking his own laws, illustrating just how soft the Tories have become on crime. And does the Prime Minister accept his words ring hollow for those of us who have lost the loved ones?
I repeat what I've said, and I know that the honourable gentleman has experienced bereavement during the pandemic, and I'm sorry for his loss, and I repeat my apologies for what happened in number 10.
Michael Fabricant.
Mr. Speaker, I was desperately sad to hear about my constituent John Robinson. My own best friend, his mother died in hospital, and he wasn't able to see her. And I do recall, of course, that the Prime Minister's mother also died during that COVID crisis. We've all suffered from these heart-wrenching tragedies, and none of us should forget it. But I just want to ask a quick question, if I may, regarding the Ukraine. The Prime Minister has announced that he's going to provide new modern mobile ground-to-air missile systems. how will we be able to train the Ukrainians during this war situation so that they can be put into use before it's too late?
I thank my right honourable friend, and I repeat my condolences to his friend. And I just to tell him on the Starstreak and other systems that we're using, that we're supplying to the Ukrainians. Ukrainians are now being trained, as you can imagine, outside the theatre, the immediate theatre of conflict.
Murray Rimmer.
Mr. Speaker, the Prime Minister genuinely doesn't seem to understand how he got his fine or what he did to break the law. He wrote, "What an utter nonsense." Does the Prime Minister understand that if a man is so incompetent that he can't understand his own rules, is he also a man who can't understand the public's challenges, the pace and scale of the soaring cost of living?
I thank her, and that's exactly why the government is focused on those issues. That's what we need to get on with. It's dealing with the aftershocks of COVID, the impact of the Ukrainian crisis on fuel prices and on inflation. That is where we are focused 100%.
Yes, someone needs to have the courage to get rid of the leader. The leader who is sitting in the Kremlin and causing the deaths of tens of thousands of innocent people. And maybe I only speak for myself, I say it in all humility. I'm not going to give the satisfaction of that death's head tyrant of removing a British Prime Minister who was given an apology, who was working night and day to save thousands of lives. You went downstairs to thank his staff who were doing the same job. He has apologised. Let's show some compassion.
I thank him very much for what he has said. I just want to say one important thing. It is very, very important in this Ukrainian crisis that we do not make it an objective to remove the Russian leader or to change politics in Iran. This is about protecting the people of Ukraine. That is what we are doing. And Putin will try to frame it as a struggle between him and the West. We cannot accept that. This is about his brutal attack on the people of Ukraine.
Yeah, I'm on the outset.
Thank you, Mr. Speaker.
Here we are again talking about the Prime Minister and his misdemeanours. It is frustrating for all of us on both sides of the House that we have to still be here. But the Prime Minister has led us this merry dance. Nobody else. The Prime Minister. Please, after all the apologies today, Prime Minister, resign, because we have had enough. The country deserves better.
Well, I thank her very much, and I must respectfully, if you'll forgive me, direct her to what I've already said.
Mark Pritchard.
Speaker, can I recognise the Prime Minister's contrition, humility and apology before the House today? Can I thank him as chair of the all-party parliamentary group on Ukraine for his leadership on Ukraine, and pass on the thanks of people cross-party from the Rada, the parliament in Ukraine, for his leadership over this conflict? And can I encourage him to steal the resolve and the resilience of our EU partners and NATO members that think perhaps if Putin gains the east of Ukraine and southern Ukraine, he will stop there? Is it not the case? He'll be reinvigorated and he will come back for Kiev and perhaps other NATO allies on another day.
Can I thank him very much for his, my honourable friend, for his clarity of thought and his own leadership on Ukraine. And I'm afraid he is entirely right that it is all too possible that Putin will acquire fresh momentum in the east, and we could see, I'm afraid, a resurgence of Russian attacks.
Joanna Chung.
Very much, Mr. Speaker. It's quite difficult to follow the Prime Minister's excuses, but I think what he's saying today is that he didn't think he was breaking any COVID rules because the gathering in respect of which he was fined was covered by a workplace exemption. If that is correct, then why did he pay the fixed penalty notice fine? Why didn't he refuse to do so and set out his defence in court? Can I suggest that he didn't do so because he was afraid of his track record to date before the courts of both this jurisdiction and indeed my own in Scotland? Because, Mr Speaker, judges and juries, like our constituents, tend to have a pretty good handle on issues of credibility and reliability. So that's why the Prime Minister didn't take his chances with the court. Isn't that correct?
Mr. Speaker, I've explained that I believed that the event was in conformity with the rules. That has turned out not to be true. I humbly and sincerely accept that.
Robert Halford.
Thank you, Mr. Speaker. I thank the Prime Minister for what he said in this House today. I think it will mean something to my constituents of Harlow. He mentioned that one of the great challenges that the government is facing is about the cost of living, and could he build on the work of the Chancellor in the spring statement to take further measures to cut the cost of living, perhaps either getting rid of the green levies that act as 25% of our energy bills, or at least introducing a downwards escalator, so when the international energy price goes high, the green levies would be reduced.
I thank him very much, and I know that he's campaigned assiduously for his constituents and for the whole country to reduce the burden, particularly of fuel costs. And I know that he will have been pleased by the Chancellor's, my right friend, the Chancellor's decision to cut 5p off fuel duty, a record cut. And I know that we will do more as soon as we can to help people with the cost of living.
Mr. Speaker, those of us who is the Prime Minister aware that those of us known him for a long time know that he spent his life apologising humbly, and those of us who know him don't dislike him or hate him, but we are waiting for signs that he's mending his ways, that he's changing how he operates. And could I just say, if he thinks that deflecting on to some of the good work he's done in Ukraine will balance what he said to this House, can I remind him he's got key links with Washington, I still have, but in Washington, in Berlin, in Paris, his behaviour here has really undermined his status and his credibility worldwide.
I thank him very much. I in no way wish to deflect from the gravity of the fine that I've received, and I want to stress again the apology, but I simply must disagree very profoundly with what he's just said.
Boris.
Mr. Speaker, I've heard the Prime Minister apologise countless times in this chamber today. I'm man enough to accept that, Mr. Speaker. But it's about a matter of trust. And this Prime Minister, I trusted him to see us through Brexit. He did. I trusted him to see us through the COVID epidemic. And bear in mind, he nearly died of it himself, and he did. And do you know something else? The whole world...
Just said, I've got to say it's got to be through the chair, not through the SNP, please. David Morris.
I totally agree, Mr. Speaker. But you know something else, Mr. Speaker, and this is the most important. This Prime Minister is leading the world against Putin's aggression in Ukraine. And the G7 leaders all respect him for that. And more to the point, so does President Biden. So I just want to say to this Prime Minister, will you carry on, please, leading this country?
I thank him very much. And the answer to that is yes, I will. But that in no way means that I wish to mitigate what the offence that I've been found guilty of, nor to in any way undermine the importance of my apology.
Alex Cunningham.
Thank you very much, Mr. Speaker. My constituent Jason Green wrote to me today to tell me how his wife lost his mother suddenly last year, but couldn't travel to be with her father, who himself died 3 days later because they were following the law. They didn't get to the funerals either because they were abiding by the law. He doesn't forgive the Prime Minister. He says the apologies are too late and the Prime Minister should resign. What's he got to say to Jason and his family?
Well done.
I apologise again not just to Jason, but to the families of all those who lost loved ones during COVID. And I repeat what I've told the House earlier on.
Alan Cairns.
you, Mr. Speaker. I thank the Prime Minister for his statement and for the way in which he made it. President Zelensky said yesterday that the conflict in Ukraine has moved to the second phase. Now, we all recognise that the balance between offensive and defensive weapons is very, very fine. As the conflict continues to develop, will my right honourable friend continue to review where that line stands?
Prime Minister. I thank him very much. He's asking an extremely important question, and the answer is that I don't think any NATO country, any Western country, wants to see its forces or its or our own weaponry directly engaged with Russia. What we want to see, that's to say, with the use of our own troops and personnel, but it is, I think, wholly legitimate and morally right to give the Ukrainians the equipment with which to protect themselves.
Thank
you, Mr. Speaker. The Prime Minister has come here today, and to some respects I would have very much welcomed an entire statement about what has been happening in Ukraine, and it does feel a little bit like he seeks cover, which is shameful. But the truth of the matter is that on the cost of living crisis, on all the issues that we face both domestically and in foreign affairs, the fundamental of whether people can trust our politics matters. And if the people in this room do not ask for the Prime Minister to bear the rigour of the things that are put in place to ensure that leaders cannot mislead this House, if they don't walk through the lobby to do that, they are setting a dangerous precedent. Yes, so through you, Mr. Speaker, I won't speak to the Prime Minister, I speak to them. What I ask the Prime Minister is, shall I look forward to this same statement at the next fine? And to stretch the metaphor of the speeding fines, after 3 fines on the road for speeding, one has one's driving licence removed from them. So at what point in his fine history will he see sense?
I thank her very much, and I want to repeat what I've said already. I apologise for the fine I received. I can't comment about any hypothetical situations.
Robin Miller.
I know that many in Aberconwy have written to me about their upset at events, but I know that many in Aberconwy too will have heard the Prime Minister's apology today and will welcome it. I welcome it. Indeed, perhaps we all have a hope that there's forgiveness in our future and not just punishment for our past. I also welcome the fact that the Prime Minister talked about his obligations. So could he please update the House then on his commitment to strengthening the United Kingdom of Great Britain and Northern Ireland, please?
I thank him very much. I thank him for all the work that he does to protect and support the Union with Great Britain and Northern Ireland, and as he knows, it's under a lot of pressure caused by the Northern Irish Protocol, which I believe is undermining the balance of the Good Friday Agreement, and we will have to sort it out, Mr. Speaker.
There's Civil Roberts.
Prime Minister debases himself, he debases his office, he debases his government, and he debases those who seek to defend him. He is a millstone round his party's neck. The Welsh Government's, Welsh Conservatives' 18-page local election manifesto makes zero reference to the Prime Minister. They don't appear, like a number of his own backbenchers, to want to be associated with him. Can he explain why?
Mr. Speaker, I think what they probably want to have in Wales is better government and to avoid and I would think they're campaigning for the investment in the NHS that I'm afraid both Welsh Labour and the Plaid Cymru have failed to deliver.
Natalie Elphie.
Thank you, Mr. Speaker. I thank the Prime Minister for his fulsome apology today. Given that, does the Prime Minister agree that the priority for this House and this government must be the very real challenges facing our country, particularly the Russian invasion of Ukraine and the cost of living pressures caused by COVID and worsened by Russia's war on Ukraine? And coming from Poland last week helping with Ukrainian child refugees, may I pass on the widespread respect and admiration with which his leadership on Ukraine is held.
Can I thank her very much for what she has been doing to help refugees in Poland, and we talked about it the other day. I know many other members across the House are doing the same, and I thank them all.
Lloyd Russell-Moyle.
Mr. Speaker, I share the Prime Minister's thoughts on Ukraine. Over Easter, my constituents collected the morning after pill to send to Ukraine for women who are being raped by Russian forces. But their disgust and their admiration about what is Britain's role in that does not dampen their anger at the Prime Minister's actions. You know, it was not just the crime, but it was the lie, obfuscation and the fake apologies that got...
No, I decide. Oh, I'm sorry, you can't take my job. You're the backbencher, I'm in the chair. Just, we don't use the word lie. I've explained that earlier and I stand by it. So I'm sure that you'll withdraw it immediately.
The sentence is not about the Prime Minister, but I will withdraw it if you don't like the word. Those are the things that got Jeffrey Archer, Fiona Onasanya and Chris Huhne kicked out of this place or forced to resign. Now, of course, I have no hope on his front benchers who are tax-dodging, Russian-financed snowflakes, but I do have higher hopes for his backbenchers. So how many backbenchers' credibility should be destroyed in supporting the Prime Minister?
Can I just say, let's try and see if we can keep it temperate and moderate. There was no individual mention, so therefore it was within. Not what I would expect, but that's where we are. Prime Minister.
Mr. Speaker, I heard what he said. I don't agree with it, and nor do I agree with what he said about the front bench.
David Simmons.
Mr. Speaker, I was lucky in that on Saturday night I got to hold the hand of my father-in-law as he died of complications of COVID. So I understand the anger that many people feel and the challenge that we all face when it comes to the credibility of our government and the good actions of this Conservative government, which I support. But I have to ask my right honourable friend what steps he has in mind to restore the moral authority of this government.
Mr. Speaker, I think the best thing that the government can do is to continue to deliver on the promises that we made to the British people, and that is what we're doing.
Caroline Lucas.
Thank you very much, Mr. Speaker. The respected constitutional historian, Lord Peter Hennessy, reminds us that it is the Prime Minister who is the guardian of the ministerial code. What can we do to protect that code when the person who is entrusted with guarding it breaks that code and its overarching duty to comply with the law and becomes, in the words of Lord Hennessy, a rogue Prime Minister?
Hear, hear. Mr. Speaker, I don't agree with that characterisation, and I've explained to the House why I spoke as I did, and I've explained and I've apologised for the mistake that I made.
Oh.
Thank you, Mr. Speaker. My constituents in Sedgefield have expressed both their satisfaction at how we are helping the people of Ukraine, but also their frustration and anger at events in Number 10. They also believe that one is not linked to the other. His contrition over his error is welcome, and I thank him for it. And whilst it was a clear error of judgment, I certainly do not believe it's a resigning matter. If it was, then regardless of Ukraine, it still would be. I, like many, have missed a funeral of a close friend, but I would still have missed that funeral, regardless of the PM's error, because the rules were correct, and his error does not change that. As regards Ukraine, though, could I please encourage him to continue his efforts with full vigour?
I thank him very much, and I share I understand the frustration and the anger of his constituents in Sedgefield, and I understand perfectly how they feel. I renew my apologies to them, and I also share what he has to say about Ukraine.
Stella Chris.
Thank you, Mr. Speaker. The benches opposite have talked about repentance. The Prime Minister has offered us
his apology, we were being asked to move on. But there's a critical question for all of us as to whether the Metropolitan Police have moved on from this matter. Now, the Prime Minister says that he cannot deal with hypotheticals, but now it has occurred to him what a party actually is. Can he tell us whether he expects more fines to come, yes or no?
I would love to give more commentary on this, but I've told the House very clearly that I can't do that until the investigation is complete.
Rob Butler. Mr. Speaker, the Deputy Head of the Ukrainian President's Office has said that the UK is the leader in defence support for Ukraine, the leader in the anti-war coalition, the leader in sanctions against the Russian aggressor. So with Russia's offensive in the Donbass beginning the next stage of Putin's appalling invasion, can my right honourable friend assure me that the UK will remain the leader of international efforts to support Ukraine, including persuading all our friends and allies of the need to stand up to Putin's outrageous actions?
I thank him very much, and I know that the whole House will want, and I think that the unity on this has been important, will want the UK government to continue to take that role, and we certainly will.
People across these islands had to watch through care home windows as their loved ones died. Parents had to bury their children without the comfort of their family around them. While that was happening, the Prime Minister and the Chancellor were partying in Downing Street. We know he has no respect for the public, but can he show us that he has some respect, just a little bit of respect for himself, and please, please, please resign now.
I'm grateful to the honourable gentleman, and I understand the feelings of his constituents, but I must direct him to what I've said earlier on.
Jacob Young. Thank you, Mr. Speaker. Can I welcome the Prime Minister's renewed focus on nuclear energy and its power to transform our energy independence? Does he also recognise we don't just need energy independence, but also independence in our foundation industries like chemicals and steel?
Yes, indeed. Can I congratulate my honourable friend on his recent marriage, by the way, Mr. Speaker, and say that we certainly see nuclear energy as of vital importance, and as well, of course, as investing in new technologies, which is why we are putting record investments into our R&D, £22 billion, Mr. Speaker.
Nadine Whittam. Nadine.
Thank you, Mr. Speaker. Mr. Speaker, the Prime Minister broke the laws that he made, laws to protect public health, then repeatedly misled Parliament. Does the Prime Minister agree that comments made by his Northern Ireland Secretary this morning, comparing his fine to a parking ticket, are insulting? And when will he do what the majority of this country wants and resign?
I thank her. I in no way minimise the importance of the fine I have received, as I've said several times this afternoon.
Richard Drax.
Thank you, Mr. Speaker. We all have our faults, Mr. Speaker, and I'm sure the Prime Minister would agree that he has his share of his own. But he also has many attributes, and one of them is courage. And it took courage to go to Ukraine, to stand up for freedom, and for those people who have been subjected to barbarism. I must take this opportunity to ask my right honourable friend, will he review the cuts to our armed forces and ensure that the future of this country is invested in to meet this future and very real threat?
I thank my honourable friend, who is a valiant campaigner for the armed forces in all their guises, and quite rightly, Mr. Speaker, and it's partly thanks to the lobbying of himself and others like him that we've increased defence spending by record sums, £24 billion, and that has enabled us, helped us greatly in helping our Ukrainian friends.
Barbara Keeley.
Speaker, a constituent wrote to me about his feelings about the Downing Street parties. Good Friday was the second anniversary of the death of his wife, a healthcare assistant at Bolton Hospital who died from COVID. Over the 10 days she was ill, he was not able to go with her to hospital or visit her until just before she died. After she died, he had to plan her funeral alone. There was no wake, and after the funeral he had to go back to an empty home with no support from family and friends. Now, it's clear that the party opposite wants to move on, but since his wife died, my constituent tells me he has been unable to work or to move on or to grieve. I want to ask my constituents questions to the Prime Minister directly. I followed the law to the letter, Why does the government think the laws don't apply to them?
I want to say again how sorry I am for the loss of her constituent, and I apologise to him personally and to his family, all those who lost loved ones. And it's a measure of the seriousness with which I take this today. Of course, we think that the law applies to us. Of course it does.
Catherine West.
At high altitude, one nose starts to bleed. With the rise in national insurance, more tax than for 70 years, our constituents are crying out for help, whether it's with their energy bills, whether it's with the rents, which have gone up by at least 20% in some parts of my constituency. And yet we will be facing this sort of debate day after day after day until the Prime Minister faces up to responsibility and resigns, or the members here take him out. That is the choice until we actually start focusing on the things which matter.
May I respectfully say to her, I think the real choice that this government, this House of Commons should follow is getting on with the job of serving the people that we were elected to serve and helping them with the cost of living. That's what we're doing.
Carol Monaghan.
Thank you, Mr. Speaker. The Prime Minister's questions on Wednesday, the 8th of December, the Prime Minister said there was no party and no COVID rules were broken. Today, he refers to his law-breaking as a mistake. Can the Prime Minister explain to my constituents, and indeed to children across these aisles, what the difference is between a lie and a mistake?
Mr. Speaker, I've apologised deeply for what I got wrong, and I've explained to the House why I spoke as I did on that occasion and others.
Wayne David.
Many references have been made to the views of the electorate of this country, and I can tell him that those views are shared by my constituents as well. So I would ask the Prime Minister, is he prepared to take a truth detection test after every Prime Ministerial statement?
I don't know whether the honourable gentleman is being serious, Mr. Speaker, but I spoke in all good faith to the House, and I'll continue to do so.
Stephen Parry.
I do wonder what continued purpose the Prime Minister sees for the Ministerial Code, given the frequency with which it's seemingly broken with impunity. And how can the UK be a credible leader for liberal democratic values around the world whenever basic norms of accountability are thrown aside to save the skin of one man?
The answer to that question is staring him in the face if he looks at what is happening around the world, Mr. Speaker. And the UK is continuing to provide moral, political, diplomatic leadership as well as military support, and that is what we will continue to do.
Justin Mathers.
Thank you, Mr. Speaker. The Prime Minister would have us believe he didn't knowingly break the law, and many of my constituents will have difficulty accepting that. But if we are to suspend belief for a minute, based on the Prime Minister's own words, he's telling the world he didn't know what the rules were. So I ask him, does he think someone who doesn't understand the laws they are bringing in is fit to lead this country?
I thank him very much. I've explained why I thought that the event was within the rules. I apologise very sincerely.
John Morrow.
Thank you, Mr. Speaker. Many Newcastle Central residents have contacted me to share precious moments missed, charging me to hold the Prime Minister to account. They don't accept his apology because, Mr. Speaker, you see, they thought long and hard about the difficult decisions they had to make, weighing up the huge personal costs versus the terrible consequences of spreading the virus. They made the right decision. The Prime Minister didn't, apparently because he is too stupid to understand his own regulations. So if he is so much stupider than my constituents, how can he claim to lead them and the nation?
I thank her constituents very much for what they did throughout the pandemic, and it's thanks to people up and down the country who followed the rules that we've been able to defeat COVID, or beat it back in the way that we have, and I apologise heartily for what I got wrong.
Christine Jardine.
Thank you very much, Mr. Speaker. I, like so many others in this place, I'm sure, are profoundly proud of the way in which the people of this country stood together, showed the commitment and the resolve that they did throughout the COVID crisis, and now are facing a cost of living crisis. And on top of all of that, have thrown their 100% support behind the people of Ukraine. But it breaks my heart, Mr. Speaker, that they have been so badly let down by the person they looked to lead them with the same sort of commitment and honour as they have shown. So I would ask whether the Prime Minister recognises that no apology, however heartfelt, however genuine, can make up for that loss of faith, and that perhaps it's time he recognises that the people of this country deserve better.
I thank her very much, and I think that and I understand completely the feelings of people about COVID, about what they did, and about the failings in number 10. But I think that the job of the government is to get on and deliver for those very people now facing the cost of living crisis that she describes, and that is what we're going to do.
Vicky Foxcroft.
Thank you, Mr. Speaker. Prime Minister, I personally found that apology shocking. People have lost loved ones and haven't been able to attend their funerals. My BTEC tutor in performing arts, Martin Cosgrave, sadly passed away from COVID. He saw something in the young me, who many felt was destined for nothing, and encouraged me to attend university. He was a fantastic man and is deeply missed by all his students. In the word of one of his friends, we were his children, yet none of us were able to attend his funeral. So what does the Prime Minister say to all of Martin's former students from Accrington and Rosendale College who were unable to mark the passing of this influential man?
Well, he sounds like a remarkable man, Mr. Speaker, and I'm very sorry for her loss and for the loss of all the pupils that she mentions.
Deirdre Brock.
Speaker, we've heard rightly from benches opposite about the barbaric nature of Putin's aggressive attitudes towards the Ukraine, but nothing about his party returning the donations they've received from friends of Putin. When can we hear about that?
Thank you very much. All donations are registered in the normal way.
Christian Matheson.
Thank you, Mr. Speaker. The honourable gentleman from Sedgefield said that he felt these issues weren't linked, but I have to disagree. We support Ukraine because we support democracy, we support self-determination and the international rules-based order. Does the Prime Minister not understand that when we go across to other countries and ask them to follow a rules-based order, they will now simply say, you don't follow your own rules, mate, so why should we follow the rules that you want us to follow? He is undermining this country and our reputation abroad.
On the contrary, Mr. Speaker, I believe that people abroad can see how closely our leaders and our rulers are held to account, and that's exactly what we're fighting for and helping the Ukrainians to defend.
Alan Brown.
Thank you, Mr. Speaker. In yet another shameless episode, the Prime Minister comes here and he says, I'm sorry I was caught, but there's a war in Ukraine, a cost of living crisis that his government's done nothing to alleviate. Is it not the case that if you've to believe the argument that this law-breaking, incompetent Prime Minister is the best the UK can rely on during this time in crisis for Ukraine and the cost of living, that then that's a metaphor for the UK that he's a figurehead of and that it's time for him to go?
I think the most important thing is we focus on the priorities of the people of this country in Scotland and around the country and tackle the aftershocks of COVID, the effects of the war in Ukraine and the impact on inflation, and that's what we're doing.
You're busy. Sarah Jones.
Speaker, does the Prime Minister think that he broke the law?
I completely accept that the police are right, and that's why I paid the fine.
Florence Eshelami.
Thank you, Mr. Speaker. At every stage, the Prime Minister has given the House and the public a different account and version of what happened, until more revelations forced him to change his mind. The Prime Minister has outlined the fact that he's sorry. The Prime Minister should be sorry because he almost died from this disease. And the staff in the St Thomas's Hospital, my constituency, treated him. They didn't have a party for 9 minutes. Does the Prime Minister not understand that he's the distraction in terms of the constituents that write to me with issues around cost of living, the crisis in Ukraine? Yeah. Will the Prime Minister do the decent thing and stop that distraction by resigning?
I think the best and most decent thing we can all do is help our constituents with the issues that matter most to them, and she's mentioned, I think, the number 1 and number 2 issues.
Debbie Abrahams.
Thank you, Mr. Speaker. Mr. Speaker, trust and confidence in our democracy is at an all-time low. Does the Prime Minister accept his part in that lack of confidence and trust? And shouldn't we also be putting the ministerial code on a statutory footing underpinned by the Nolan principles in the same way that it is in the devolved governments?
I thank her, but I want to repeat what I said earlier on, which is I think that there couldn't be a clearer expression of the robustness of our democracy, that all of us must be held to account. I've been held to account. I apologise very sincerely.
Matt Weston.
Speaker, the public will be appalled by the Prime Minister's statement, because not only during the pandemic did he make virtually every night a statement to the nation, but the government that he leads also spent hundreds of millions of taxpayers' pounds on advertising campaigns demanding the public follow the rules. One featured a woman in intensive care on a ventilator. The Prime Minister must have seen it. It said, "Look me in the eyes and tell me you never bend the rules." 3 months ago, I reminded him of this and asked him to explain himself. He told me to wait until after the police investigation. They now have. It's clear he bent the rules. He's taken the public for fools, isn't he?
Yeah. Mr. Speaker, I apologise again. I thank the public very much for what they did, and they, by their collective action, have helped us to keep COVID at bay, and I thank them very much.
Timms.
Mr. Speaker, but giving an apology and then carrying on is not being held to account. Does the Prime Minister recognise that there is a very serious problem for the long term in leaving a lawbreaker in charge of the lawmakers?
Mr. Speaker, I've said what I've said, and I apologise, and I want to say again to the House that when I spoke before in this chamber about events in Downing Street, I spoke in good faith.
Pete Wishaw.
Mr. Speaker, the Prime Minister spent less than 2 minutes addressing his law-breaking in the statement he just made to the House just now. That's less, somewhat less than the fulsome account that he promised for the last few weeks. And the one thing that our constituents wanted to hear was a resignation statement, not any more of these mealy-mouthed apologies. And the public will be astounded that the word that they now most associate with him, we can't use to describe him in this House. The country knows where he is. We know where he is. I think the Prime Minister even knows where he is. Will he now, for the sake of this country, just go?
I thank you very much, and I repeat what I've said earlier on. I apologise, and I direct him to my earlier statement.
Dr. Rupert.
Thank you, Mr. Speaker. Margot from Acton turns 5 on Saturday. We were talking at an Easter service over the break. She wanted me to ask the Prime Minister, will he come to her party? And her parents, in common with the majority of our nation, look at any opinion poll, think that he should signal his intention to step down today. So to spare the embarrassment of the local election results, of further fines to come, he can't rule out further fines, the even more boozy parties, much worse than ambushed by a cake. Can he do both? And that way, he's got able deputies. He can have something nice to look forward to at the weekend where there will be no illegality.
I thank her very much for her kind invitation. I don't know whether Margot herself wants to extend the invitation, but I'm afraid I'll be busy doing what we're doing and getting on with delivering on the priorities of the British people.
Thank you, Mr. Speaker. Lord Denning said, no matter how high you are, the law is above you. Isn't it time to go, Prime Minister?
And I agree very much with Lord Denning, and that's why I apologise in the way that I do.
Brendan O'Hara.
Thank you, Mr. Speaker. And reading the Prime Minister's apology, can I say on behalf of the people of Argyll and Bute, is that it? Yeah. And it's no wonder I've been inundated with emails from constituents who believe the Prime Minister has been treating them like fools. Typical of the emails I've received is one from Cathy in Helensburgh this morning, who described the Prime Minister, and I quote, a self-serving, truth-twisting charlatan. Of course, I would never use such language in this place, but Cathy's assessment is absolutely correct. And does he recognise this to be a widely held view of his character?
Yeah. It does. Sorry, I've asked for moderate and temperate language. That's not a clever way of getting around it, and I'd just ask him to think long and hard before we do that again, and that might be a warning to others. And I'm sure he'd like to withdraw the way he put it.
Mr. Speaker, with respect to yourself and the Chair, I withdraw the remarks that I made.
Well, in that case, Mr. Speaker, I humbly remind him of the apology that I've given.
Stephen Kinnock.
Thank you, Mr. Speaker. The Prime Minister's case for his defence seems to be based on it being impossible for him to resign because of the Ukraine war. But his entire parliamentary party, from where his replacement would be drawn, are united around the government's position on Ukraine. And of course, there are numerous examples of Conservative members of Parliament moving against leaders such as Margaret Thatcher in 1990 and Chamberlain in 1940. So could the Prime Minister please explain to the House why he specifically and individually has to carry on as Prime Minister at this time? Surely it's not because he thinks this House trusts him to do so.
He asked an elaborate question. Let me give a simple answer. I've apologised. I continue to apologise. What I want to do is get on with the job.
Sir Mark Hendrick.
Speaker, can the Prime Minister tell us when he's going to stop this dissembling, distracting and deflecting and start telling the truth to this House?
Mr. Speaker, at all times I've spoken in good faith of this House.
Mr. Speaker, this is the first Prime Minister in office to make and break his own rules for committing lockdown offences. Neil Ferguson resigned from SAGE and Catherine Caldwood quit as Scotland's Chief Medical Officer, both for breaking COVID rules. They realised that action speaks louder than words, and they took responsibility. Why is it right for them to resign and not for the Prime Minister?
I thank you very much, and I repeat the apology that I've given.
Mike Ainsbury.
Thank you, Mr. Speaker. The Prime Minister has broke the law, guilty as charged. The law that many people up and down our shores abided by, never had the opportunity to say goodbye to loved ones. The Prime Minister also misled this House over and over again, misled the public over and over again. Does the Prime Minister actually believe in a ministerial code? Is it worth the paper it's written on?
Well, Mr. Speaker, let me repeat my apologies for what I've got wrong and what went wrong in Downing Street, and also my explanation for why I've spoken as I have in this House.
Thank you, Mr. Speaker. Originally, there was one party, and the Prime Minister told the House that he had been assured that there was no party. It then turned out that there were parties, but he wasn't in attendance. He then had to tell the House that he had, in fact, attended parties. He told the House that he'd been assured on each occasion of the truth of what he said. So someone must have committed a serious breach of their responsibilities to advise the Prime Minister in a way that led to him coming to this House and inadvertently misleading the House. What's happened to those people?
Mr. Speaker, I've apologised for what I've got wrong, and I take full responsibility for everything that happened in number 10. And Mr. Speaker, as for the rest of his question, he must wait for the completion of the investigation.
Zara Sultan.
Energy bills are soaring, wages are falling, and the cost of living crisis is getting worse and worse.
But while my constituents are forced to choose between heating and eating, the Chancellor is benefiting from the non-dom tax loophole, and 17 of the Prime Minister's 22 cabinet members have refused to deny whether they or their families benefit from tax havens or non-dom status. They're laughing in our faces while robbing the public purse. So I ask the Prime Minister, how many more children need to go hungry at night before he stops putting the greed of his super-rich mates before the needs of ordinary people?
Sorry, can't you withdraw robbing the public purse? That's just not the case.
Oh, withdraw it.
Yes.
Withdraw it.
Steve McCabe.
Mr. Speaker, if the Downing Street photographer is a publicly funded post, does that mean all the photographs of the Downing Street parties are public property and should be available for access?
Mr. Speaker, I'm not going to comment on the investigation until it's complete.
Andy MacDonald.
Thank you, Mr. Speaker. Truth and honesty matter, and the Prime Minister has repeatedly told this House that all guidance, all rules were observed. That isn't true. He also told this House that there were no parties. Indeed, his Chancellor also said that he hadn't attended a party.
Yes.
Neither of those things are true. So, for once in his privileged, entitled life, will he do the decent thing, come to that dispatch box and correct the record? Because there isn't anybody who's fooled by this, but what he continues to do is to take the British people for fools, and they will not put up with it.
Yes.
Well, Mr. Speaker, I thank you very much, but I want to repeat what I've said about the event in question, for which I've received an FP, and I apologise heartily for that, and it was my mistake entirely. I thought it was within the rules, and it has turned out not to be the case. As for other events, I'm afraid I'm going to have to stick by what I've said previously and await, and I hope he will allow me await for the conclusion of the investigation.
Alison Thewlis.
Thank you, Mr. Speaker. Mr. Speaker, I got many emails from my constituents over the weekend. One of these has stuck with me. It's from Victoria, who worked in respiratory wards during the COVID-19 pandemic. She says, "I've watched people die alone, sick and confused, begging us to see their family one last time, with only us to hold their hands and comfort them. I've watched family members banging on the locked doors, ward doors, crying, screaming and pleading for us to let us hold their dying loved ones. We were the ones that watched this and enforced this. We were the ones who had to tell families how sorry we were, but the government guidelines meant they couldn't hug their families one last time." Victoria says the time for apologies are over. We don't accept them. When will the Prime Minister resign?
Well, Mr. Speaker, I want to thank her for what she's said, but I want to remind her of what I've already said, which is I feel the greatest sorrow and grief for those like Victoria who have lost loved ones during the pandemic. Mr. Speaker, I understand the pain that they must feel and the anger that they must feel, and I repeat my apologies.
Paula Barker.
Thank you, Mr. Speaker. The fact the Prime Minister and the Chancellor have both been fined for breaking the very rules they themselves set means they are either incompetent or they think the people of our country are beneath them. Either way, and with the prospect of further fines looming for the Prime Minister, they are not fit to occupy the two highest offices in the land. My constituents of Liverpool Wavertree have overwhelmingly told me, Mr. Speaker, that they do not believe their apologies to be sincere. So the question from my constituents of Liverpool Wavertree is when can they expect your resignations?
I thank her, and I can't, Mr. Speaker, offer any further commentary on the investigation. All I can do is renew and repeat the apologies that I've given to her constituents, whether they accept them or not.
Dave Dugan.
Speaker, only this Prime Minister
could have, together with his staff, laughed up their sleeve, believing they were above the law, and demonstrated to an entire country that they're beneath the public's respect, more accurately. And vacuous self-congratulations from the Tory opposite about the role that this government is playing in Ukraine are a disservice to the servicemen and women who are actually in country, doing the spade work, protecting democracy. And to use the bloodshed of the fallen Ukrainians as some sort of political cover to keep this Prime Minister in office is an utter disgrace, but no less than my Angus constituents have come to expect. This government is compounding the cost of living crisis, but we are led to believe that that, together with the Ukraine crisis, is why we must endure this Prime Minister. So let me test his knowledge. What anti-ship missiles will his government be sending to Ukraine? And if he can't answer that simple question, will he resign?
Well, I'm grateful to him, Mr. Speaker. But one of the systems that we're looking at, since he asks, is to see if we can mount some brimstones on the back of technicals to see if that will do the job, Mr. Speaker. But there are other options that I don't want to discuss.
Martin Docker to use.
Mr. Speaker, let me first of all wish the Prime Minister good luck in their trip to India, where I'm sure he will raise the ongoing arbitrary detention of Jagtar Singh Johal with Prime Minister Modi. But that said, if the Prime Minister believes that they inadvertently misled the House based on evidence given at the time, surely the Prime Minister would then agree with me and also with Alex Macy of The Spectator that such a defence rests on the proposition that the Prime Minister is an idiot.
I've spoken in good faith, Mr. Speaker, and of course continue to raise the case of his constituent.
Flynn.
Does he believe that a Prime Minister of the United Kingdom who openly treats the public like they are mugs is a help or a hindrance to the cause of Scottish independence?
I believe the biggest help to the cause of the Union is the incompetence of the Scottish Nationalist government.
Thank you, Mr. Speaker. The whole functioning of this place hangs on the belief that everyone behaves in an honourable way at all times. Unfortunately, the people that matter out there don't believe that we do. We now know that 72% of them think the Prime Minister is part of the problem. For 72% of the citizens of these four nations, they cannot hear the two words Boris and Johnson without immediately hearing a word that I'm not allowed to say on their behalf. Is the Prime Minister really going to look my constituents in the eye and tell them that the best future they can hope for is a future under a Prime Minister whose character and conduct can only be described in words that are banned from use in this place?
I think the best future for the people of Scotland is to continue with the United Kingdom that has served this country well for hundreds of years and whose role is valued around the world, perhaps never more than in the last few months.
It's not a new member for the SNP. Jeff Smith.
I couldn't find a space. It's so busy, Mr. Speaker. The event in question happened on the 19th of June 2020. 2 days later, on the 21st, my constituent Stephen's partner died of cancer at home. In the weeks before that, she was in hospital, and Stephen said, when she needed me most, I was told I could not visit her because of the no visitors rule. In the texts I received from her, it was obvious that she needed somebody to just talk to and hold her hand. Stephen obeyed the rules, and like so many people, he thinks the Prime Minister should stand down. But the defence from the Conservative backbenchers seems to be he can't resign because we have a crisis in Ukraine. So does the Prime Minister think he's the only person on the Conservative benches that's capable of leading the country through a crisis?
Mr. Speaker, sincerely too, I think he said the name of his constituent was Stephen, and to his family for what we got wrong, what I got wrong during the pandemic, and the event for which I've apologised today. But I think the best thing we can do, and I've said what I've said about how I've spoken in this House. But the best thing we can do is get on now with delivering for the people of this country, up and down this country, getting us through the pandemic, getting us through the aftershocks of COVID, as I say, as we got people through the pandemic.
We now come to the next statement, where I call the Secretary of State for Business, Energy. There is no point of order. We're in the middle of statements. Secretary of State.
Thank you, Mr. Speaker. With your permission, sir, I will make a statement on the British energy security strategy. Our strategy, Mr. Speaker, Mr. Deputy Speaker, provides a clear long-term plan to accelerate our transition away from expensive fossil fuel prices set by global markets we cannot control. It builds on our success over the past decade, in which we gave the go-ahead to the first nuclear power plant in a generation, and we have achieved, Mr. Deputy Speaker, a five-fold increase in renewables. The British energy security strategy marks a significant acceleration in our ambition. It is confirmation of three mutually reinforcing goals of our energy policy, indeed of any well-constituted energy policy: security, affordability, and sustainability. Mr. Deputy Speaker, we recognise the pressures that many people across our country are facing with the cost of living. This has been greatly influenced, as we all know, by global factors. And that is why my right honourable friend, the Chancellor of the Exchequer, has announced a £9 billion package of support, including a £150 council tax rebate this month and a £200 energy bill discount in October to cut energy bills quickly for the vast majority of households. We're also, sir, expanding the eligibility for the warm home discount, which will provide around 3 million low-income and vulnerable households across England and Wales with a £150 rebate this winter. And of course, as I speak and as is ongoing, our energy price cap is still protecting millions of consumers from even higher wholesale spot gas prices. Furthermore, we're investing over £6 billion in decarbonising the nation's homes and buildings, and this was set out very clearly in last year's Heat and Buildings strategy. This saves the lowest income families around £300 a year on their bills. I want to reassure the House that the Chancellor has promised to review his package of support before October and will decide on an appropriate course of action at that time. Mr. Deputy Speaker, cheap renewables are our best defence against fluctuations in global gas prices. By 2030, 95% of our electricity will be produced by low carbon means, and by 2035 we aim to have fully decarbonised our electricity system. So we will double down on every available technology. The strategy sets out a new ambition to propel our offshore wind industry, and it will increase the pace of deployment to deliver 50 gigawatts by 2030 instead of the 40 committed to in the manifesto. And of that 50 gigawatts, up to 5 gigawatts will be floating offshore wind. The strategy also commits us to slash approval times for new offshore wind farms from 4 years to 1 year. And we also feel, Mr. Deputy Speaker, and it's reflected in the strategy, that our solar capacity can grow by up to 5 times by 2035. Mr. Speaker, Mr. Deputy Speaker, most of Britain's nuclear fleet, as is well known, will be decommissioned this decade. We need to replace what we're losing, but we also need to go further. From large-scale plants to small nuclear modular reactors, we wish and we aspire to provide a steady baseload of power that will complement renewable technology. The right time, obviously, to have taken these decisions would have been 20 years ago. But of course, the party opposite all but killed off the British nuclear industry. And that is why we will be reversing decades of underinvestment, and we will be building back British nuclear. We aim to deliver up to 24 gigawatts of nuclear power by 2050, approximately 3 times more than today, and this will represent 25% of our projected energy demand. We're also, Mr. Deputy Speaker, doubling our ambition for low-carbon hydrogen production. The capacity we aim to reach by 2030 is 10 gigawatts, with at least half of this total coming from green hydrogen, electrolyser-produced hydrogen. This fuel will not only provide cleaner energy for vital British industries to move away from fossil fuels, but will also be used for storage, for trains, for heavy equipment, and for generating heat. The transition to cheap, clean power, Mr. Deputy Speaker, cannot happen overnight. Those calling for an immediate end to domestic oil and gas ignore the fact that this would simply make the UK more reliant on foreign imports. It would not, in fact, lead to greater decarbonisation globally. Mr. Deputy Speaker, producing more of our own energy will protect us into the future, and we feel that this historic change, this decarbonisation challenge, represents a huge opportunity for the United Kingdom. More wind, more solar, more nuclear, while also using North Sea gas to transition to cheaper and cleaner power. This is a long-term plan to ensure greater energy independence and to attract hundreds of billions of private investment to back new industries that can create, again, hundreds of thousands of high-quality jobs and stimulate business across the UK. This isn't only a matter of reaching net zero, vital as that is. It is an issue of national security, and these are all objectives that everyone across the House, I'm sure, shares. We all wish to see a homegrown clean energy system that will protect our people into the future, that will create good, clean jobs, that will attract private investment, and above all will drive down bills for British people, and I commend this statement to the House.